So my name is Dr. Frank Aieta. I'm a naturopathic physician, and I have a private practice in West Hartford, Connecticut. I've been in practice going on 18 years. And so tonight I want to just kind of share with you a little bit about the profession. We'll go over some case studies, talk a little bit about the philosophy of naturopathic medicine and how it contrasts with conventional medicine. Um, and then at the end, if we have any questions, I'll be more than happy to answer them all for you. So I'd probably like to start off with, maybe not everyone on the call knows what a naturopathic physician is or what naturopathic medicine is. And I'll kind of tell you a little bit about my journey through all of this and kind of give you an idea of what I do on a daily basis. So my undergraduate degree is in nutrition and exercise science. I've always had a kind of a thirst for knowledge when it came to health and diet and lifestyle. And because when I was younger, I had a lot of health issues. I had a lot of asthma, allergies, digestive issues. And I went to, my parents took me to a million different conventional doctors with virtually no relief at all. Just another medication and move on. So I finally, I was in my teenage years in high school, and I brought it upon myself to start doing some research. Now, this was back in the early 90s, late 80s, early 90s, before even the internet. And so I'm in, the library, reading books, bookstores, reading as much as I can on ways to treat my ailments that were different from what conventional doctors would recommend to me. So the more I read, the more I learned. I started, applying it to myself. Changing my diet, taking vitamins, nutrients, herbs. And lo and behold, I was able to kind of reverse my asthma, my allergies, and my digestive issues. And a lot of it came down to diet. Now, I was amazed, I'm like, a young kid, teenager at the time. And I thought to myself, why did none of these doctors tell me any of this stuff? Why didn't some doctors say, why don't you try cutting dairy out of your diet or getting off of grains or wheat and see how you feel? Not one doctor that I went to ever did that. They just pump you full of more and more medication. So I was always from a youth, I was always kind of skeptical of conventional medicine. Not saying that there's not a place for conventional medicine. Obviously, if if you're having a heart attack, you get hit by a car, emergency medicine, conventional medicine does very, very well. But when it comes to treating chronic illnesses, I find that conventional medicine really misses the boat by a long shot. And we'll talk a little bit about why, why their approach to disease is kind of backwards. Okay. So going back to my story when I was younger, I always, like I said, I was always interested in nutrition, exercise. And so I went to undergrad. I studied nutrition at UConn, exercise science. But the nutrition that I learned really didn't do it for me. I felt I learned more on my own just studying. The nutrition that I learned in undergrad at conventional undergraduate school at UConn really didn't hit the mark. It was more RDA stuff. There was no talk about treating disease with diet and lifestyle. It was just more or less calories in, calories out. And so I got the degree and I wanted to go further. And I was reading, just happened to come across an article in the local newspaper about a school that was opening up right, about a half hour from where I lived. And it was a naturopathic medical school. And I said, well, what is this? So I started doing more research on naturopathic medicine and come to find out this is what I've been looking for. My whole life, I was looking for this type of doctor. Didn't know it existed. Like most people don't. So as I looked into it more, I found that naturopathic physicians are licensed physicians in the state of Connecticut. Their license law is from 1919, actually. And so we are also licensed in a handful of other states. And so I went to an orientation. I talked to the dean of the college and I said, this is right up my alley. So 4 years later, after, going through it and then doing a little residency and doing an internship and taking advanced classes in acupuncture, I was a licensed naturopathic physician. So let's talk a little bit about, what do I do? So, and what's the contrast to conventional doctors, conventional MDs or DOs? Well, as a naturopathic physician, the main goal is to provide treatment that is non-toxic, okay, first and foremost. And so we utilize diet, lifestyle, we do acupuncture, we use botanical medicine, nutrients, dietary supplements. I do physical medicine similar to what a chiropractor will do, homeopathic medicine. So anything that falls under that alternative medicine umbrella, we're basically trained to do. So after the first 2 years of naturopathic medical school are very, very similar to conventional. We have our hard sciences, our anatomy, our physiology, and then we get into more of the physical, clinical diagnosis and so forth. And that's where the last 2 years kind of differ. We still learn about medications and drugs in minor surgery and how to run labs and how to make a diagnosis, but it's our treatments that differ. In certain states, we are licensed to prescribe medications, but we use those sparingly. Okay, we use the drugs sparingly. We use these other modalities first and foremost. Is kind of the way that it really should be, even with conventional doctors, because we're going to talk a little bit about, what I see in my practice when it comes to conditions. And most of the conditions that I do see, I consider them more functional problems. So what's a functional problem? It means that it's not necessarily an overt pathology or disease yet. It's more or less the person's developing certain symptoms. And a lot of those symptoms can be related to dietary shortcomings, nutrient deficiencies, maybe some hormonal imbalances, underlying infection that's not being addressed. So these functional problems, when you go to your conventional doctor and say, I'm tired all the time, I'm a little achy, my joints are hurting me, they're gonna apply a treatment that is more of just a palliative type of treatment, more or less. They may look a little bit deeper, but a lot of times they don't look for the root cause of what's causing these symptoms. They just go ahead and treat the symptoms. In conventional medicine, they very rarely go searching for the root cause. A lot of times it's just kind of patch you up and move you on your way, or apply a palliative treatment or a symptom-based treatment. Whereas I strive as a naturopathic physician to look deeper to uncover the root cause of what the person's coming in for. So in my opinion, when a person presents with a symptom, it's their body telling them something, telling them, we got to look a little bit further, something else going on here. It's kind of like the fire alarm going off. It's your body's fire alarm telling you, okay, we got to put the fire out, instead of just smashing the fire alarm, which is essentially what's done in conventional medicine quite often. Now, in conventional medicine, there is one type of therapy that does actually go for the root cause a lot of times, and that's an infection. So if someone presents with an infection that's caused by a bacteria, they use an antibiotic. And now an antibiotic actually addresses the root cause of what the person's presenting with. But a lot of times other situations, other symptoms are not being addressed by the root cause. So let's talk about some examples of cases where a patient will come in and may present with some symptoms, and then the doctor just goes ahead and treats just the symptom with a drug. So let's use depression as an example, because I treat a lot of mental, emotional, neuropsychiatric issues in my practice, completely natural, without using any drugs. So let's talk a little bit about, let's say a patient presents to my office with a history of anxiety and depression. Well, the first thing that I'm going to look at is, okay, well, is it a situational thing? Are you in a situation that's making you anxious, making you depressed? Or is this just is this a true depression or true anxiety where we need to uncover the root cause. It's not a situational thing. The person's feeling fine. They could be sitting on the couch, relaxing, and all of a sudden go into a panic attack. Well, in conventional medicine, what they typically will do is apply a treatment called, whether it's called an SSRI, which would basically raise serotonin levels, or they would give an anti-anxiety medication to kind of calm down the nervous system. But once again, they're just addressing the symptom without going towards the root cause. What I look for is, so let's say a patient comes in and they have all these issues. First thing I look at is I talk to them. I say, okay, if let's say they have anxiety. One of the main reasons why someone will present with anxiety is an inability to regulate their blood sugar. Okay, so pretty simple. Someone may be going long times without eating, and subsequently their blood sugar will drop and they go into a panic mode. Their body starts secreting adrenaline, they get anxiety. And I find that this is the case in a lot of patients, yet most doctors don't look for it. I mean, it's something so simplistic, and so most conventional doctors don't have training in nutrition, so they're not going to look for this first. They're not going to talk to a patient about what their diet's like, what their lifestyle is about. They may say, well, what are you stressed out about? What do you have going on in your life? And they'll say, nothing, I don't have much going on. Okay, no problem. We have a pill for that. We're going to fix you up and you go on your way and you start taking these medications. When they stop working, you come back, we'll switch you off, we'll put you on something else. So first thing I do, obviously look at diet, look at lifestyle. The second thing that we look at is the adrenal system. So we have a system called the adrenal. We have two glands that sit above our kidneys called the adrenal glands. And the adrenal glands produce hormones that help our body deal with stress. Now, if that gland is overworked, and I'll explain to you why the adrenal system can be overworked. I mean, most of us can relate to this. We live in a society where we're under chronic stress all the time. So these little walnut-sized glands that sit above our kidneys that are there to help our bodies naturally deal with stress can stop working 100%. Not that they're going to shut down completely. In some cases they can, and this is more of an overt pathology, but when we're looking at something more of a functional issue, these glands just are unable to produce the adequate amounts of hormones to help the body deal with stress on a daily basis. So one thing that we look at is, we talked about the whole blood sugar thing. When their blood sugar drops, they can get into this hypoglycemic attack and they secrete adrenaline, which makes them feel anxious. Well, it's the adrenal system that prevents this whole aspect from going on. So let's say, for example, a person, is eating sugar and carbohydrates as their primary fuel on a daily basis. So every time they eat something with sugar or carbohydrates, their blood sugar spikes and then it drops. And when that blood sugar drops, their adrenal system produces hormones to help bring that blood sugar up. And the first hormone that's produced is something called cortisol. So cortisol is a stress hormone, and the body will produce cortisol, and the cortisol will break down protein in the body, convert it over to sugar, and raise up the blood sugar. Now, it does this very, very gently. We don't feel any jitteriness or shakiness, but what will happen is when our adrenal glands are being burdened on a daily basis, so we have this blood sugar going up and down, up and down, up and down, our body's responding to that reaction. And over time, the adrenal glands stop producing this adequate amounts of this cortisol, so the body goes into a major stress zone, and that's called a fight or flight response. So the adrenal glands produce another hormone called adrenaline, okay? And adrenaline's a big one. I see it on a daily basis. People are walking around in this state of adrenaline dominance, okay? They're constantly, they're wired all the time, but at the same time feeling kind of more run down and tired. So when they're tired, they drink coffee, it revs them up, it kicks those adrenal glands to work even more, burns them out even more. So when the adrenal glands are conked out from working so heavily, to regulate your blood sugar, now we're stuck in this fight or flight response. So when I look at the picture of anxiety, it's a lot different than how the conventional doctors will look at it. I'll look at it and say, let's start working on this person's diet. Let's change their, get them off all the sugar, the carbohydrates and starches. Let's stabilize their blood sugar, get them to eat some good fats, some proteins on a daily basis with each meal, get away from all the standard American diet. So pretty simple. And just by doing that, in a lot of these cases, patients' anxiety starts to go away. The other thing is we'll use things to nourish the adrenal glands. We'll use different herbs and nutrients. Vitamin C is important. A lot of vitamin C concentrates very heavily in the adrenal glands, pantothenic acid, zinc, and copper. So we have a lot of different nutrients that are, a lot of B vitamins as well, that the adrenal glands need to function properly. So that's just one particular issue is the anxiety. So let's look a little bit at depression, because this is something that plagues a lot of people out there. I mean, on a daily basis, I see patients coming into my office on medications to treat depression. So what's interesting about depression is, and when conventional doctors treat it, they're using a drug called an SSRI, selective serotonin reuptake inhibitor. So basically what happens is we have a nerve cell that's talking to another nerve cell, and this nerve cell is sending out a signal to this one. And that signal is a chemical messenger called a neurotransmitter. And one in particular that we're going to talk about, and there's a bunch of them, and we'll talk about one in particular, which is called serotonin. And so serotonin is that feel-good neurotransmitter. You need a good connection between these two nerve cells. And so what happens is that in people that are prone to depression, they may not be making enough serotonin. And so one reason why a patient wouldn't be making adequate amounts of serotonin is because they're lacking specific nutrients. Now, serotonin is a brain chemical, but it's formed in the body through a process where it converts an amino acid called tryptophan. Okay. We all know about tryptophan. We hear about that with turkey. You eat the turkey, you get the tryptophan, you get tired. Well, tryptophan is a very, very important amino acid. Tryptophan plus B6 in the body will convert over to serotonin. So if a person is not getting enough protein in their diet, they're not getting enough B vitamins, they're not going to adequately produce serotonin. So doesn't it make more sense from a treatment standpoint to get the person eating more protein, get them on some B vitamins, or give them a targeted amino acid therapy of some tryptophan to convert and raise the serotonin levels? So that would be addressing the root cause. What do the drugs do, like Zoloft and Paxil and Prozac? What do? They essentially keep the serotonin in the gap between the two cells a little bit longer. It prevents the neurotransmitter serotonin from being reuptaken by this nerve cell. So it just kind of keeps more in that gap a little bit longer. But the problem is that it's not doing anything to improve the body's natural production of this brain chemical. It just recirculates. It's just keeping around the little bit that you have in that gap junction there. So the problem is that eventually that's going to wear off. You're going to run out of that serotonin. So what ends up happening? We switch medications. We go on this medication. We try this one. We up the dosage. And then ultimately what can happen is it loses its efficacy. And I see this time and time and time again in my practice. The other thing is that a person can be genetically susceptible to low levels of serotonin. Now, every patient that comes into my office, we run complete blood work on, and we'll talk about what type of blood work I run on all my patients. But I have all my patients fill out a questionnaire. It's a pretty cool questionnaire. It basically clues me into specific genetic predispositions that person may have. So, for example, there's an enzyme system in the body in the brain that's responsible for breaking down serotonin. It's called an MAO enzyme. And so in certain people that are genetically predisposed to depression, that enzyme may be fast. And that enzyme may be breaking down serotonin in the brain faster than the body can produce it. And this is even more of a problem if the person has a poor diet or lacking specific nutrients. They're constantly in this rut of low serotonin, which will result obviously in depression and anxiety and sleep issues and so forth. So once I identify that through questioning, then I know, okay, this person genetically is and I obviously ask about their family history. Do you have anyone else in your family that has depression or anxiety and so forth? And this can really clue me in. So once I identify that, there's a lot that we can do nutritionally to turn this around. And I can tell you how many patients that I've seen over the years that have come to see me on these hardcore medications for years and years and years, and we get them off of it. We don't get them off it right away, but we make some changes, some diet changes, lifestyle changes, and we start incorporating some of these treatments to naturally raise their brain chemistry. So I've had conversations with conventional doctors about this, and they're familiar with it, but they're not trained in it. So they don't look at that first, which is where I go always. I say, okay, someone has depression, someone has that. What's going on? Where is it coming from? Is it a nutritional thing? Is it a genetic thing? Is it an environmental thing? So the thing about genetics is interesting because all of us have a genetic predisposition towards something. Okay, so one person may be genetically susceptible to lung cancer, but never get lung cancer. Or someone else will be susceptible to an autoimmune disease, but never get it. Why do people develop diseases due to genetic variations? Well, something environmental turns that switch on. And 9 times out of 10, it's something in our diet, something we're getting exposed to in the environment. And, so all of these, toxins, chemicals, additives that are added to vaccines and whatnot, that are added to medications, chemicals that we come across in the food supply. We eat enough of these things, we do enough of these things, and boom, lo and behold, we turn that switch on and we develop some type of condition. But the nice thing is that in conventional medicine, they don't believe that you can turn that switch off. We say, okay, well, genetically, this is a genetic disorder. We have to treat this, just palliate it and just treat the symptoms. But from my standpoint, I'm able to turn that switch off in a lot of cases. And a lot of times it just comes down to, basic things, changing their diet, changing their lifestyle, getting their nutritional levels up, and that in itself can turn that switch. I want to switch gears a little bit and talk a little bit. So we touched a little bit about diet and lifestyle. And one of the things that I also find, diet really, really, really has a huge impact on our overall health. And I've talked to so many conventional doctors over the years, and patients will come to me and say, I'll give you a good example. I had a patient just the other day who has a condition known as Crohn's disease, which is it's an autoimmune disease that affects the bowel, the end part of the small intestine. It becomes inflamed. There can be strictures in there, a lot of digestive issues, malabsorption. And the doctor says, there's no cure for this. We're going to put you on a drug to suppress your immune system. And, that's all we can do. And the patient asked the doc, well, isn't there something I can do as far as diet? I know, doesn't diet affect it? Doctor said straight to the patient's face, nope, diet has nothing to do with this. You can eat whatever you want. It has no impact on whether you're going to feel good or bad. Patient's like, but when I eat this food, I don't feel good. But when I eat this food, I feel better. No. The food does not impact this condition. This is a genetic condition that was, the switch turned on, and you're destined to have this the rest of your life. You have to just manage it. Well, when I heard that, I kind of chuckled a little bit, because I said to the patient, well, that's odd, because I've treated probably more than a dozen cases of Crohn's or ulcerative colitis, and have been just with diet and lifestyle and nutrition, and gotten people off of those immunosuppressive drugs, just doing the basics. So where do we start? So for example, one of the things that I would do for anyone with digestive issues or any type of inflammatory issue is we can test to figure out what type of food may be driving this whole process. So this is pretty interesting. Everyone's familiar with allergies, food allergies, environmental allergies. Well, what I look for in patients that present with chronic illness, autoimmune diseases, inflammatory conditions, I look for what are called food sensitivities. And this is extremely important. So I want everyone to know about this, because it's just knowing this little piece can really change outcome of what may be going on with people listening here. So there's a test that's available that checks for what's called food sensitivities. I want to differentiate between food allergies, food sensitivities, and food intolerances. Okay, so a food allergy is, we all kind of know this. You put a food in your mouth, immediate reaction typically ensues. Like, for example, a peanut allergy. A kid with a peanut allergy, put a peanut in their mouth, their throat may close up, they can't breathe, here comes the EpiPen. So overt food allergies, we can test for them, but I don't typically do that. Most of the time, patients will come in and say, I can't have this, I will develop this type of symptom. Okay. So a food allergy typically affects 3 areas of the body: the respiratory tract, the digestive tract, or the skin. Okay, those 3 areas are typically affected by a food allergy. Now, food sensitivity is a little bit different. A food sensitivity is more of a delayed or cumulative reaction to a food. So, for example, someone can eat an egg for breakfast, feel perfectly fine. 5-6 hours later, develop symptoms. They can get joint pain. It can affect their brain. It can affect their digestive tract. So a food sensitivity can affect anywhere in the body, not just the skin, respiratory tract, or digestive tract. It can affect anywhere. And so this is how it works. In our digestive tract, in our small intestine, we have a very tight barrier between what stays in the digestive tract and what gets absorbed into the bloodstream. And that's there for a reason. Something like 80% of our immune system resides in the walls of our intestinal tract. That's how important it is to really screen what gets into the body, what gets into the bloodstream, because the digestive tract is actually considered outside of the body. You don't realize that it's outside. It's considered outside because if the contents of your digestive tract got inside of the body, non-selectively, it would be called sepsis. You'd have an infection. So in the small intestine, we have this barrier. And so let's say we eat an egg for breakfast. We digest that protein, ideally breaking it down to its smallest little parts, those amino acids. And so those amino acids, as they float down through the digestive tract, they selectively cross this membrane barrier into the bloodstream. The body picks it up, the tissues pick it up, and we utilize those amino acids to make brain chemicals, to replenish the muscle mass. If we have glucose, our cells can burn that up, free fatty acids. But what happens if a protein is not digested too well? Like, for example, let's say someone eats an egg for breakfast, and after eating that egg, they're taking a medication like a drug called Prilosec. Okay, Prilosec is an antacid. That's what it does. It shuts off your stomach acid. So let's say a patient's eating breakfast in the morning, they have a history of a little bit of heartburn, and so their doctor prescribed them an antacid. And so they don't digest their proteins properly. So instead of breaking down their protein to their smallest little parts, now we have these large intact proteins going through the digestive tract. And if the digestive tract, the lining there is a little bit porous or a little leaky due to some inflammation or irritation, that protein molecule is going to move right past the cells into the bloodstream. And once that protein molecule gets into the bloodstream, the body's going to say, hey, what's that doing here? That's not supposed to be here. That's a foreign invader. Just like if a bacteria or a virus got into the bloodstream, the body would say that's not supposed to be here. Or if you walked into a pollen storm and breathed in all these pollen proteins, your body's going to make a reaction to it. And so when that protein gets into the bloodstream, the body starts making antibodies, and those antibodies start attacking that protein. And in that process, it calls in white blood cells, and we have an inflammatory process going on. Now, if we go one step further, and people that are susceptible, maybe someone's susceptible to autoimmunity due to a genetic predisposition. Let's use rheumatoid arthritis for an example. So we have someone that may be susceptible to developing rheumatoid arthritis. They're taking an antacid, or they're just not chewing their food properly. They're eating a lot of food all at once, and their digestive tract is not able to break it down enough. Now that protein molecule slides into the bloodstream, and the body starts making antibodies to it. But those same antibodies that are attacking that protein can cross-react and start attacking your own tissue. And that's what happens in an autoimmune process. There's a dysfunction of the immune system, and it's driven potentially by food, okay? Something that you're eating on a daily basis. And I see this time and time again. In conventional medicine and in naturopathic medicine, well, we know there is a condition known as celiac disease. Now, celiac disease is an autoimmune disease, and we know what the cause is. It's one of the very few autoimmune diseases where we actually know what the cause of it is, and it's gluten. It's eating gluten in the diet. So these people, if they eat gluten, that gluten molecule gets into the bloodstream and the body starts attacking it, and then subsequently it starts destroying the lining of the intestinal tract, leading to more of this, what's called leaky gut. So now they may have a gluten allergy or sensitivity, but then they can start developing other sensitivities to other foods. So when a patient comes into my office, is one of the first tests that I run on them. I can actually run a food sensitivity test. It's a simple test. It's a finger stick. We prick the person's finger. We take 5 drops of blood. We send it into a lab, and they match your blood against 132 different foods and food additives. And basically what they're looking for is an immune reaction. And they're also looking for an inflammatory reaction between that protein and your blood. And then they report it. And so it's based on a scale of 0 to 4. 0 meaning no reaction, 4 meaning it's a major inflammatory reaction. So what's interesting about this test is that there's a lot of good research on it. They've done some independent research with this test where they took, let's say, a group of 1,000 different people with all different types of conditions, ranging from, joint pain to brain issues to, cognitive issues, any type of inflammatory condition. They ran the test on them, and they took them off the foods that came back suspect. And it was like a 90% correlation between what in terms of the results. When they took the people off of the foods, we saw a gradual resolution of a lot of the symptoms. Maybe not all of them, but through questionnaires and so forth, we find that most of the people in the group felt better and had a resolution or a diminishment of their symptoms, which is pretty interesting. So that's my first go-to when I see a patient, especially if we're trying to uncover the root cause of what's going on with someone. So in conventional medicine, if you go to a doctor and you complain of joint pain, muscle pain, things like that, they run some tests. They say, okay, we found that you have rheumatoid arthritis. The treatment of choice is an immunosuppressive drug. That's where they stop. They'll put you maybe on a prednisone or a steroid, which will suppress the immune system, reduce the inflammation, kind of get things under control. But then they want to get you off that prednisone because it's not good to stay on that long term. So then they put you on what's called a biological medication, which essentially poisons the immune system. It kind of shuts down the immune system. So immune system is kind of important. As we all know, we need the immune system to fight off infections, to fight off cancer. And so I see this quite often in my practice. Autoimmune diseases are on a massive rise. So I think one of the reasons why is because of the food supply. Yes, we're eating foods that are genetically modified. These proteins are kind of, almost like space alien proteins that our bodies are not equipped to deal with. And so once those proteins get into the blood, the body sees it as foreign. And so we also have a lot of food additives and things like that, which can cause major, major damage to that intestinal lining, making it more leaky. So these proteins can keep translocating into the bloodstream, further exacerbating it. A lot of the medications like prednisone and steroid medications, those work, but they subsequently can cause more problems because they thin and weaken that that lining of the digestive tract. So once again, so as you're all seeing, just from these couple examples, the differentiation between how I like to approach it and people in my field like to approach disease compared to the conventional doctors. So pretty interesting stuff. So that test is, like I said, one of the best something I run on almost all my patients across the board. And I can tell you, so my experience with it myself was maybe 6-7 years ago. I developed Lyme disease. I live in Connecticut. Lyme, Connecticut's maybe 45 minutes from my house, and that was where the first cases of Lyme disease showed up. And so I developed Lyme disease. I was bit by a tick. I never saw the tick, never pulled anything off, never saw a rash. I just got sick. And I ended up, thank God, I recognized the symptoms and was able to treat myself naturally and reverse it and, cure myself of the Lyme disease. But what ended up happening was the bacteria got into my system, and it broke down the digestive barrier. And I developed all these different inflammatory issues. And I said, this is not linked to the Lyme disease. I think the Lyme is gone. The bacteria is eradicated from my system. Why am I still in pain? So I ran this test, and lo and behold, it showed up maybe a half a dozen foods that my body was reacting to. And the crazy thing was, it was all the foods I was eating on a daily basis, good foods. So eggs showed up. I was eating eggs, every other morning. I was eating egg white protein bars and different things. Gluten showed up. I don't really eat a lot of gluten in my diet, but I find that it is a reactive molecule. So it was a little low on the list. Salmon. I mean, come on, salmon's great for you, especially if it's wild caught and it's not a genetically modified one. But salmon showed up, a bunch of other things. So I said, okay, that's got to be what it is. That those foods are driving the whole situation. And it has to be that my gut barrier is leaky, probably from the Lyme disease. It disrupted my whole system. So I took those foods out of my diet, and lo and behold, a week goes by, all of the residual symptoms that I was still having went away. The knee pain went away, the sleeplessness went away, the anxiety went away. I felt 10 times better just by eliminating those foods. And what's cool about identifying those foods and then eliminating them is that allows your gut lining to heal. Now, I always implement a treatment plan right along with it. Obviously, we're going to eliminate the foods, but I also do things to heal and seal that gut lining back up. There's one amino acid derived from protein called glutamine. And glutamine is a fantastic nutrient for the cells of the intestinal tract. It provides ability for those cells to heal. Other nutrients, vitamin A is very, very important for mucous membrane healing. And there's a slew of others. Zinc is really super important. And so I did a gut healing protocol along with the elimination of the foods. And so I stayed off those foods had to have been about 6 months. So I remember I was, feeling really good, and I was away with my wife, and I said, you know what, I'm going to try some eggs today. I'm going to see what happens. I think I've done a lot of good work. I've healed up my digestive tract. I think I've calmed down the immune system. Everything should be good. So we're out, and I order an omelet, and I eat the omelet, and I wait that whole day. I wait the next day, because with food sensitivities, you can have a reaction 5 hours later, or you can have a reaction 2 days later. So it can be very, very difficult to identify just by trial and error what type of foods may be contributing to your issues. Okay. So I waited that whole day. I waited the next day, no reaction. I said, oh, fantastic. So the third day comes, and I said, I'm going to try it again. I'm going to see, I'm going to push the envelope a little bit. So I ate some eggs again that day. 5-6 hours later, started getting a little achy in my knees. So I knew that I could have eggs maybe once a week, maybe space it out a little bit. But I found that I can't do it more than that. If at this point, that was 5-6 years ago, I can pretty much do eggs, 3-4 times a week without any problems. And I can also added salmon back in, and I added all these other foods back in, which is pretty cool. So I treated my underlying condition simply by eliminating the food, doing some gut healing, and then subsequently was able to add the food back in without any reaction. And I find this with a lot of my patients is that, when I take them off the food, their gut's allowed to heal, their immune system down regulates, stops overproducing antibodies that are attacking your tissues and so forth. And we do this gut healing thing. Because remember, 80-90% of your immune system is found in your digestive tract. So it makes sense that, the first entry route into the body, we got these checks and balances there. So, but if those immune cells are dysfunctional and they're attacking everything under the sun and revved up, we need to calm that down. So that's a interesting case and things to look at. The name of the test is called a food inflammation test. Now let's touch a little bit about food intolerances, because food intolerances are a little bit harder to identify. There's no major test for it. I mean, there's a couple things that we could do. So lactose intolerance. Okay, so lactose is a sugar that's found in dairy. Now, someone doesn't necessarily, so people confuse a lactose intolerance with a dairy allergy. It's not a dairy allergy. When you have an allergy, the body is reacting to the protein found in the dairy, the casein or the whey component. Same thing happens with a sensitivity. Now, with an intolerance, it simply means that you just can't digest lactose. You may lack the enzyme in your digestive tract that breaks down the lactose, allows you to digest it. There's also another type of intolerance called a histamine intolerance, and I find this quite often in patients. Now, in our digestive tracts, we produce, if we have a nice functioning digestive tract, we produce an enzyme called a DAO enzyme. And this enzyme is responsible for degrading and breaking down histamine that's found in our food. So certain foods can cause histamine to be released or may contain histamine. So some certain foods that contain histamine are red wine, cheese, chocolate, avocados, any type of fermented foods. Foods that are left in the refrigerator, leftovers, can develop, they can cause histamine release. So these people may present with a reaction after eating certain foods. They may get flushed, they may get hot, they may break out in hives, they may get digestion, their stomach could get distended. So so these types of intolerances can be, we kind of have to identify those through clinical signs and symptoms. Now, what's interesting is that DAO enzyme found in the digestive tract, certain people genetically produce less. And those people will have a DAO enzyme kind of deficiency. Now, how do I treat that? Well, we clean up the gut. We take them off foods that are these high histamine containing foods. We do some gut healing. And that way we have a less likelihood of them developing these intolerances. And so those are the three areas that we have to look at. So when you think about like how I explain it, it's almost kind of like a no-brainer. Like, why isn't every doctor doing this stuff? Well, it comes down to the lack of training. Now, we're trained as a naturopathic physician, we're trained in all aspects of diet and lifestyle and nutrition. And we're taught about some of these, we're taught about a bunch of different tests that aren't mainstream, yet. Conventional medicine, it's crazy because everything in conventional medicine is like 20 years behind. Things that I've been talking about for the past 18 years are just coming to light. I've been talking about the use of vitamin D for not just for absorbing and utilizing calcium in the body, but for managing a lot of different chronic conditions. And I've been talking about this for years. Just within the past 4 or 5 years have conventional doctors been testing vitamin D levels. I've been doing it for 18 years now. And I mean, when I used to run vitamin D levels, it would take several weeks to come back because they'd have to send it out to California and they'd have to run a specialty test. Not everyone was running it. But I came across the use of vitamin D for chronic illness through research. And one of the big things that I read a research study showing that vitamin D has a positive impact on lowering blood pressure. So it works almost like what's called an ACE inhibitor in the body. It lowers blood pressure. And it's found that people with higher blood pressure tend to have lower levels of vitamin D. So here's a very, very interesting case that kind of looks at addressing the root cause. I had a patient come to see me. Must have been about 10 years ago. So middle-aged man, probably around 48, 50 years old, comes in and he says, Doc, I'm here because I have uncontrolled blood pressure. I'm on 3 different blood pressure medications. The doctors don't know what's going on. It's so erratic. One day I go in and it's nice, it's normal. The next time I go in, it's off the charts. They think it's like a white coat syndrome. I'm getting nervous. I'm getting anxious. So I said, okay, well, what time of the year do you find that your blood pressure is the highest? Oh, hands down. He says, hands down. He goes, wintertime. I don't know why. He goes, maybe because I'm less active. I work as a landscaper in the summertime. So I'm very, very active. I'm moving around. I'm losing weight and so forth. And then I'm a little bit more sedentary in the wintertime, but not much. I don't gain a ton of weight, but he goes, there's a very distinct differentiation between what my blood pressure is like in the summertime versus where it is in the wintertime. So I said, okay. So I run some blood work on him after, I took more of his history. And one pertinent piece of information that he did give to me was that his blood pressure has been dysfunctional, been all over the place for the past 5 or 6 years. And in taking his history, he told me that I think it was 4 or 5 years ago, he had his gallbladder removed. Okay, so let's remember that little piece of information. He had his gallbladder removed 4 or 5 years ago. And that's kind of right after that. He said, it's his blood pressure right around that time zone, blood pressure started getting out of control. So I ran some blood work on him, checking the typical stuff. I checked his magnesium levels because low magnesium can also contribute to variations in blood pressure. But I checked his vitamin D level. And vitamin D levels ideally should be about 50 to 75. That's where I like to see him. This guy's vitamin D level was 6. So at the time when he came to see me, it was in the late fall, I believe. It was just going into wintertime. And so I said, 6, wow. I go, that's super, super low. The rationale behind it, the reason why his vitamin D levels were so low is because he had his gallbladder removed. Now, your gallbladder is in your body to produce bile. It stores bile. And so what's bile used for? Bile is used to emulsify fat when we eat fat in our diet. So let's say we eat a couple hard-boiled eggs. The fat in that egg, it hits your digestive tract. Your gallbladder secretes a metered amount of bile. It causes emulsification of the fat. It kind of floats to the surface. Our digestive enzymes and stomach acid starts breaking it down, and we absorb the fat. Okay. We also absorb our fat-soluble vitamins this way through the use of bile. And so what's vitamin D? Vitamin D is a fat-soluble vitamin. So this guy wasn't taking any vitamins or anything like that. His diet was kind of crappy. It wasn't the best. And, you do get vitamin D from the sun, okay? If you're not getting it from your diet, you got to get it from the sun. So maybe during the summertime, he's out in the sun enough so that, he's getting enough vitamin D, which subsequently helped with his blood pressure. And then in the wintertime, he's not exposed to any sun. His gallbladder is gone. So he's not able to adequately absorb his fat-soluble vitamins. So this guy was vitamin D deficient. And that is what was causing his hypertension, amongst other things. He also had some blood sugar imbalances. He was like a pre-diabetic as well. So what we did was tightened up his diet, put him on a bile supplement, a bile salt supplement, and put him on massively high dosages of vitamin D. And over a period of 3 months of doing this, like miracle, his blood pressure came down and he was able to get off all of his medications. I mean, this guy was like a lean guy. He didn't look like someone that should have high blood pressure, no family history of it. But his vitamin D levels, his body was so so susceptible to hypertension secondary to low vitamin D. But once we corrected it, boom, his blood pressure was normalized. So just that was addressing the root cause. So he went to his conventional doctor, put him on a beta blocker, ACE inhibitor, a diuretic, put him on all these blood pressure medications to just treat the symptom. The symptom was high blood pressure. Now, I have another case that has to do with fat soluble vitamins and the loss of a gallbladder. This was a woman, and she came to see me, and she said her primary complaint was over the past several years, her eyesight started to gradually get worse. And she was developing a lot of issues at night. She couldn't drive. At night, she had such poor vision at night, almost night blindness. So what did I think? Okay, so I take her history, another one that had her gallbladder removed. And so she had her gallbladder removed, and I ran her vitamin A levels, okay? And her vitamin A levels were like non-existent. So we all know you need vitamin A for your eyes. And she says, I can't believe my vitamin A is so low. Why? I said, well, it's a fat soluble vitamin. You don't have a gallbladder, so you're not absorbing your vitamin A. She's like, I eat plenty of carrots and things like that. I said, that's beta carotene. That's not vitamin A. And we subsequently also found that she had a low thyroid function. And so even if she was getting a lot of this beta carotene and all these things in her diet, beta carotene is an inactive form of vitamin A. The body has to convert beta carotene to vitamin A. You need proper thyroid hormone to do that. The other problem is you need vitamin A for your thyroid to function properly. So it was just a vicious cycle with this woman. So we put her on a bile salt supplement. We put her on very, very high dosages of vitamin A. And lo and behold, her vision started to improve. Her night blindness went away. And we tightened up her diet a little bit. And we also did some things to address her underlying thyroid condition. And so lo and behold, all these symptoms started going away. One of the other things that we found with her was she had pretty bad acne. And so that was another one of her complaints. And she said, my face is always so freaking oily. It's always producing so much oil. Well, when you're vitamin A deficient, you tend to overproduce sebum or oil in the skin. And actually, they know this in conventional medicine. They know that vitamin A is great for your skin. But what they do is when a patient comes in with acne, there's a drug called Accutane. It's a synthetic form of vitamin A. And it's very, very, very toxic. And so, in fact, if they have to, if a patient goes on this, a woman, they have to make sure they're on 2 forms of birth control. They have to, get pregnancy tests and so forth, because this high dose of vitamin A is teratogenic. It'll cause birth defects. So this is a really hard medication. It's really hard on the liver and so forth, but it's a synthetic form of vitamin A. So once we started treating this woman, we make sure she's absorbing her vitamin A. We gave her enough. Her skin cleared up almost 100% just by using, vitamin A. And so her doctor was treating her acne, which was making things even worse, with antibiotics, low dose of antibiotics, which was screwing her digestive tract up. All those antibiotics on a daily basis, every single day of her life, just to kind of keep her skin clear. And it wasn't even really clearing up her skin, ended up causing major, major issues with her digestive tract. So I think this whole issue, it just kind of snowballed. And so she was on all these different medications, but when all she needed was some bile supplement, change her diet, and take some vitamin A. So pretty interesting case. Let's talk a little bit about, we'll talk a little bit about diet, and I'll talk about what diet I feel is kind of the optimal type of diet for most people walking around. So, the standard American diet, as we all know, is really riddled with a lot of sugar, carbohydrates, and starches. Now, I think one of the major reasons why it's like that is because fat in our diets has been so demonized over the years. We all know about this, back in the even back, this kind of all started, like this whole low fat revolution kind of started back in the late 80s and 90s when, they had these Snackwell cookies and stuff. They were high in sugar, everything low fat this, low fat that, fat is the enemy. We started introducing a lot of these vegetable oils, and they're supposed to be heart healthy and so forth. And we kind of abandoned a lot of our traditional fats in our diets, like our ancestors used to eat. They would eat, they would cook with lard. They would, cook with butter. They would, they'd eat the, organ meats and so forth. We've kind of changed, that whole paradigm has changed. Everyone is, so fat phobic. And I think now people are learning a little bit more. But back then, we see it, if you look at graphs of, illness and so forth and chronic disease, it kind of all it started kicking in this big ramp up once we started changing our diets from our traditional ancestral diet into these kind of fake foods and genetically modified foods and, low fat and, lots of, chemicals that they put in preservatives and additives and so forth. So in people, I'm telling you, like most of the patients that I see that come into me, most of them are addicted to these types of foods. Sugar, carbohydrates, and starches can be a very, very addicting type of food. They've done research showing that sugar actually stimulates the same area of the brain as cocaine. So there is a very, very addictive quality to the foods. And plus, they put all these additives and flavor enhancers and things to get people addicted to food. So when patients come in to see me, that's the first conversation that I have. I kind of go through, okay, what do you eat for breakfast, lunch, and dinner? And a lot of times people just rattle off what they, people are eating the same thing over and over and over again. And this is one of the reasons why people can develop a lot of food sensitivities, because if they're bombarding their digestive tract with the same proteins over and over and over again, multiple times a day, and they have a kind of a, porous digestive tract, all those proteins are getting in there. So I go through their diet and we kind of make some modifications. But one of the main things that I do with patients is I get them off a lot of these sugars and carbohydrates from their diets. And I push them more towards a low carb type of diet, which I feel, in my opinion, is the absolute best diet on the planet. A high fat, moderate protein, low carb diet. And then in certain situations, if the person's obese, if they have diabetes, we may go even further and put them more onto a ketogenic type of diet, which is a further progression of a low carb diet. So let's talk a little bit about the 3 macronutrients in our diet. And I'll kind of touch on the whole ketogenic diet a lot. It's kind of all the fad now. I've been doing ketogenic diets with patients when I was in medical school. So probably close to 20 years. And I've been following more of a low carb ketogenic diet myself for probably that length of time myself. I have a strong family history of diabetes and cardiovascular disease and heart disease and so forth. So following this type of diet is a very, very healing and curative type of diet for all of these types of conditions. So let's talk proteins, fats, and carbs, okay? Because there's a lot of misconception about, how much of these things we're supposed to be eating in our diet. So let's talk about fat first, because it's the most misunderstood, in my opinion, by the people, just people in general. When you eat fat in your diet, we're talking about eating real fat, eating the whole egg, grass-fed meats, wild-caught fish. If you're going to do dairy, it's always grass-fed, pasture-raised, nuts and seeds, things like that. Just coconut oil, olive oil. So all of these good fats in the diet, what your body does with fat, and most people don't realize this. People think they eat fat, they're just going to get fat, that there's no value in eating fat, that it's just going to put weight on you. When you eat fat in your diet, the first thing your body does with that fat is it uses it to make things. So your body will take dietary fat and it will replenish the nervous system. All the nerves in your body are coated by a thin layer called a myelin sheath that's all derived from fat. Our brain is a big ball of fat. 25% of the cholesterol in our blood goes directly to our brain. Our body also uses dietary fat to make hormones. male hormones, female hormones, stress hormones, that cortisol that our body makes, testosterone in men, estrogen, progesterone in women. So our body uses fat to make structure, okay? So it replenishes the nervous system. Your body also burns fat as a fuel. Certain types of fats your body can burn a little bit quicker than others. So if your body uses all that fat to make things and to burn, whatever's left over is considered excess. And that excess actually gets sent to our liver, and our liver will convert that excess fat over to sugar. And we'll either burn that sugar as a fuel, or the liver will turn it into something called a triglyceride, which is a storage form of body fat. So before your body takes dietary fat and turns it into body fat, it turns it into sugar first. So you can kind of see where I'm going with this. Big misconception about fat. Protein is next. The amount of protein that someone should eat in their diet is based upon them as an individual. So if a big bodybuilder comes walking through my door, he's going to eat a heck of a lot more protein to maintain that lean body mass opposed to a 90-pound woman. And so we would adjust the amount of protein that person should be eating based upon their lean body mass, because protein primarily should be used as structure. Now, our body will utilize amino acids after your protein has been broken down to make brain chemicals like we just talked about, to make some glutamine to heal our gut and so forth. But primarily, protein should be used as a structural component. So if we take in enough protein, our body will use it for structure. But if we take in too much, what happens? It's excess. Our body will convert that excess protein over to sugar. It's a whole process in the liver called gluconeogenesis. So you take that protein, turn it into sugar. If you either burn that sugar, but if you have too much, your body will store it directly as body fat in the form of a triglyceride. Sugar, carbohydrates, starches, whatever you want to call them, they're all the same, is the last macronutrient that we want to talk about. When you eat carbohydrates, starches, or sugar in your diet, what your body does, there's no structural value. Your body can't make any structure from carbohydrates. It's strictly fuel. It's like rocket fuel. And what ends up happening is that your body will burn what it can, store some in your muscles, your liver, and your kidneys as glycogen to be used as a quick energy source. But the rest is considered excess. And so your body will promptly convert it over to a triglyceride, which then gets stored as body fat. So you have a limited window of how much carbohydrate that you should be consuming on a daily basis. So if we have an athlete, like Michael Phelps, that's swimming in 50-degree water and, swimming this guy can probably eat as many carbohydrates as he wants. He's going to burn them all off. And he's very, very lean. But for the most of us, we're not working out. We're not running marathons every day. We're not doing this type of stuff. So all these excess carbs that we're eating in our diet is just overkill. That's why most people walking around, you go to the mall and sit there and watch people walking around. Most people are overweight. So that's the first thing that I do, is to get people away from these excessive amounts of carbohydrates, starches, and sugar. Yes, people are going to get carbs in their diet. We're not putting them on a zero carb. They're not just eating meat and fat. So where do we get our carbs from? Where's the best source? From vegetable sources. So all vegetables, lots of green vegetables. These are the best because they have low amounts of sugar, lots of fiber in there, and a lot of phytonutrients, okay? So we want to use, we can get it from vegetables. We can get it from nuts and seeds, contain a little bit of carbohydrates, full fat dairy, and the lactose. Berries is a good source of nutrients, polyphenols, and so forth. A lot of different nutrients that are found in berries. In their low glycemic index, they tend to have a lot more fiber and lower in sugar. So these are all great sources of carbohydrates that aren't going to mess with you. They're not going to be above and beyond. Now, I can tell right away when I run blood work on someone. I can tell right away just by looking at someone if they're overdoing carbohydrates. They're typically going to have a spare tire around the midsection. They may, when we run blood work, their blood sugar may be elevated and so forth. But one of the big things that I look at every one of my patients is their triglyceride levels. Remember, taking more carbs than what your body can burn, your body promptly converts it over to triglycerides. So if I run a blood test and I see that their triglycerides are to the moon, guess what? They're way over consuming carbohydrates, starches, and sugar in their diet, and they need to back off of it. So that's one of the things that I do first is get people off of those. So I explain to people, let's think about our body like a campfire, okay, or like a furnace. And we're trying to keep our metabolic fire going. Now, does it make sense if you're trying to, keep a fire going by throwing sticks, twigs, and paper on that fire to keep the fire going? Or does it make more sense to throw a big log on that fire? Well, eating carbohydrates, starches, and sugar as your primary fuel in your diet is like trying to run your metabolic fire with sticks, twigs, and paper. It burns very quickly and then it goes out, very quickly, and then it goes out. And so subsequently, you have to eat quite often. Okay. All these people, they have to eat a breakfast, eat a snack, eat lunch, or otherwise their blood sugar drops. And so we're trained to just eat all day long, these cheap garbage food, all these carbohydrate based foods. Now, it makes more sense to adapt the metabolism away from relying upon sticks, twigs, and paper, all this sugar, carbohydrates, and starches, and get the body to learn how to burn stored body fat and dietary fat. So stored body fat is like throwing a big log on that fire. But most people walking around have tens of thousands of calories of stored body fat that they never access. They just never, they don't tap into it. Why? Because their body's too busy burning sticks, twigs, and paper. They're too busy trying to keep their fire going all day long. Now, when you go more towards a low carb paradigm and even go into more of a ketogenic type of state, what is ketosis? Ketosis is when the body, when you limit the amount of carbohydrates in the diet and you force the body to access the wood on the wood pile, okay, which is basically the stored body fat. So what ends up happening is your body goes into this state of what's called nutritional ketosis, where you start liberating these energy units from your fat cells. They're called ketone bodies. And what's interesting about ketone bodies is that your brain really runs very, very well on ketones. So does your heart and all of your other organs. And most of us don't realize, but we're born into this world in a state of ketosis, okay? Mother's milk, the first milk, is very, very high in fat and very low in carbohydrates, actually. So this is kind of how our ancestors ate. Our ancestors, if our ancestors relied on sugar, carbohydrates, and starches as their primary fuel, we wouldn't be here today, okay? Our ancestors lived through multiple ice ages over the years, and so they actually thrived on the meat, organs, and fat of animals, okay? So looking back at our, ancestral background, that's kind of what happened. I mean, yes, they'd find a little bit of vegetation, some berries and things like that, but not much. And so our bodies still take on that primal physiology where we're not really equipped to consume massive amounts of sugar, carbohydrates, and starches, especially in the forms that we're getting them in today. Like the white bread and pasta and things like that. These spike your blood sugar so fast, it's unbelievable. A white piece of bread can actually spike your blood sugar faster than a candy bar in certain situations in certain people. They're like super carbs. And that's what we're doing all day long. We're feeding our body sticks, twigs, and paper to keep our fire going. So it makes more sense to get the person's metabolism adapted so that they're able to easily access the stored body fat. And some people, it takes a little bit longer to get to that place. And some people, it's a little quicker. And they can fall in and out. I mean, I'm not saying everyone needs to go strict ketogenic, but if they have diabetes, if they have, heart disease, things like that, going into a ketogenic state is probably a really, really good thing. I treat a lot of patients that have seizure disorder with a ketogenic diet. And I treat cancer patients with a ketogenic diet. And what's the rationale? Well, with a patient that has seizure disorder, ketones provide great fuel for the brain. Very, very steady. No choppiness, up and down, up and down. We talked in the beginning of this talk about maintaining proper blood sugar. when your blood sugar's up and then it drops down, you're constantly cranking out that adrenaline, okay? And adrenaline can spark off seizure disorder. So if you put a patient on a ketogenic diet, their blood sugar is nice and steady all day long. It's interesting because, in our bloodstream, in a fasting state, there's probably only like a teaspoon, like 5 grams of sugar coursing through our veins at that time. And we go ahead and eat, a bowl of cereal that has 50 grams of carbohydrates. Okay, well, that's just, what do you do with all that? You can only burn so much. If you're going to eat that and go sit on the couch, where's it going? So this is an area that I have a lot of passion about. I've written a book on diet as well, and my main diet in the book is a ketogenic, low carb type of diet. And everyone's different, everyone has their own carbohydrate tolerance. Everyone so some people can tolerate more carbohydrates. They have a fast, speedy metabolism. They're more wiry, they can burn, they're active. They can burn through those carbohydrates. But the problem is you still don't want to feed those people tons and tons of carbohydrates. So my kind of rule of thumb for carbohydrates is, I tell patients just very simply, we're going to run your triglyceride levels. If your triglyceride levels are over 100, we know you're taking in too many carbohydrates. So we're going to cut you down. And we're going to cut you down until those triglycerides are below 100. And once they're below 100, we can kind of fine tune it and we can see what that person's tolerance level is. And once we achieve that, then they kind of go from there. Then they can easily maintain their weight. Their moods are more stable. They sleep a heck of a lot better. That's one of the things that I typically see in a lot of patients whose blood sugar is up and down, is they have very, very erratic sleep patterns. Why is this? Okay. So insomnia is one of the biggest problems that I see in my practice. Okay. So everyone's got sleep issues. It's like, why do we have sleep issues? Well, maybe because, we're sleeping with our cell phones right next to our head. Maybe we're on these computers with all this blue light and everything. I mean, that's part of it. But a big, big part of the reason why people have a problem either falling asleep or waking up throughout the night is that they're having a very, very hard time regulating their blood sugar. So we talked about, that fight or flight response, that adrenaline response. When your blood sugar goes up and then it comes down, if you don't have enough of that hormone cortisol to regulate your blood sugar, you're going to go into an adrenaline phase. What happens when you have an adrenaline surge in the middle of the night? You guessed it, you wake up, okay? And so one of the things that I talk to patients about who have issues with sleep is, if we can control your blood sugar during the day, make sure it's nice and steady, that will translate to more stable blood sugar levels at night. Also, if the person's adrenal glands are weak and we strengthen them, the body will be able to maintain that blood sugar. So let's talk a little bit about cortisol, and again, which is that little stress hormone produced by the adrenal glands. So and we'll tie this into the whole sleep equation and all the adrenaline. So as I'm talking, I'm going to kind of go back to other topics that I brought up and tie it all together. And by doing that, you'll see how you can't just treat symptoms. You have to look at the big picture. And that's constantly what I'm trying to do when I see patients, is I'm trying to take these little tidbits of information and tie it all together. So a patient says to me, I can fall asleep all right, but I wake up multiple times throughout the night and I'm wide awake and sometimes my heart is beating hard. I know for a fact that they probably have some adrenal issues. They're having a very, very hard time in blood sugar issues. They're having a hard time regulating their blood sugar. So this hormone cortisol, what's interesting about it is that cortisol is released on a circadian rhythm. It's highest at 8 o'clock in the morning and lowest at midnight, okay? So let's talk about why this is. So it kind of waxes and wanes. It goes up and down. So cortisol levels are highest in the morning and lowest at night, because after midnight, the cortisol levels start to creep up. And by 8 o'clock in the morning, they're at a peak. Now, why is this? Why is the body doing it in this fashion? Well, let's say we eat our dinner at 6 o'clock, okay? So we eat dinner at 6 o'clock. We go to bed at, let's say, 10 o'clock. What's keeping our blood sugar steady between 6 o'clock and 8 o'clock in the morning? Well, It's cortisol. So after midnight, the cortisol levels start to go up, and cortisol, we know, helps regulate our blood sugar. So as the blood sugar is going down, the cortisol is going up, and it's taking the blood sugar for a ride. And so that's why at 8 o'clock in the morning, blood sugar is it should be at a little bit at its highest point, and also your cortisol levels. Well, if someone's adrenal system is not working 100% because it's kind of burnt out from doing this all day long, up and down, up and down, up and down, well, what's going to happen is if your cortisol levels during the day are half of where they should be, they're going to be half of where they should be at night. So instead of the person being able to keep their blood sugar steady at 2 o'clock in the morning, now they're hitting rock bottom, and then they're surging with adrenaline, and that's waking them up out of a sound sleep. Okay. So right then and there, I know right away what we need to do with that person. We need to address the root cause. No, we're not going to give them Ambien. We're not going to give them, Xanax or something to knock them out. What those drugs essentially do is they basically blunt that adrenaline response. Okay, just prevent your body from kind of waking up by just kind of numbing you out. And so, yes, you can do that as a treatment. You can stay on those medications the rest of your life, but they're very, very addictive. They're also linked to a lot of weird stuff. I've had patients take an Ambien and wake up and they're out in their driveway. And also there's a strong link between these type of medications, these sleep medications and these anxiety medications that are also used for sleep, and memory loss. So, and there's also this dependence, and it's also a chemical that your body has to deal with on a daily basis. So it makes more sense to have take the extra 10, 15 minutes to talk to the patient regarding lifestyle things. Okay. Maybe eat a little something with some fat and protein before you go to bed. That may keep your blood sugar steady throughout the night. Let's do some things to help your blood sugar stay steady during the day, and that will translate to better blood sugar at night. So these are all little things that, they seem simplistic, very, very simplistic. Like, okay, it's, you're changing someone's diet, you're cutting out the carbs, you're doing this, you're doing that. But no one talks about this. Conventional doctors are not talking about this stuff. They think, if it's not if it's not a drug or surgery, they have no treatment for it. They don't know what to do. So like I said, a lot of the symptoms that I see that patients come in to see me with are functional problems, dietary shortcomings, nutrient deficiency, hormonal imbalances. And when a doctor gets a hold of you, they're just going to treat those symptoms until those functional problems evolve to an overt pathology, okay, in an overt disease. And so what do? So a lot of times the doctors will wait until it gets to that overt disease process. And the biggest problem is now it's a chronic disease. Now they want to apply an acute treatment to a chronic illness. They want to suppress this. They want to block this and do that and do this. And it doesn't work because that person eventually is just going to get sicker and sicker and sicker. And so every medication that you're placed on will always cause a side effect someplace else. I use this analogy that, if you're getting rid of a symptom over here, it's got to go someplace. It's always going to go over here. And then you're treated with another drug to deal with that, and over here and over here and over here, opposed to looking for the root cause. So once again, you're going to hear me say this over and over and over and over again, time and time again. One interesting case that I had that really, goes along with this whole concept of addressing the root cause is I had a patient come to see me, a female, and she said, I have a bunch of things going on. I'm losing my hair pretty rapidly. Okay. My hair's falling out. I'm clogging the shower. My skin is very, very dry all the time. I'm putting on weight. I'm tired. I can't get out of my own way. And I've been to all these doctors and they say, you're probably just depressed. We'll put you on antidepressant. And she was depressed, So we'll put you on this medication. We'll put you on a diet pill. We'll put you on something for your hair. So this woman came in to see me and she was on like 10 different medications, each one of them addressing all these different symptoms. She's rubbing this special cream on her dry, rough, bumpy skin. And so I run some blood work on her. And the interesting thing about blood work, and this is kind of an important thing to know, most people will go to their doctor and their doctor will run blood work, and the doctor will say, "Oh, everything's good. Everything's within the ranges there, so you're doing perfectly fine, everything." But doc, why do I feel this way? Why is my hair falling out? Why do I have all these issues? Well, it's not the blood work. There's nothing going on. It's not this. So it's got to be, maybe you're depressed. Okay. If they can't figure it out, if the blood work doesn't show it, they can't put a finger on it. They run an x-ray, they do this, do that. They can't figure, you're depressed. Okay. It's all in your head. So the problem with that is that when you look at blood work, okay, this is a very, very important topic to everyone, to hone into everyone. When you look at the reference ranges that the laboratory gives, so let me give you some examples. B12, for example. B12, the reference range for B12 goes from 200 to 1100. Pretty broad reference range, very, very broad. Now, how do they come up with this reference range? Like, most people think, okay, well, it's got to be based on clinical research. If the level goes too low, the person's going to develop some type of symptom. If it goes too high, so that's probably how they figure it out. That's not how they figure it out. How they figure out the reference ranges at the laboratory is they take, let's say, the last 1,000 patients that went to the lab that are considered so-called healthy. What constitutes healthy? I don't know. Most of the people I see that come into my office are really not healthy. Most of the people walking around that I see are really not that healthy. So I don't know what constitutes them being healthy. A lot of these people are volunteers as well. A lot of them are medical students that they kind of recruit to get, to run blood work on and so forth. And we know how I know medical students are not the healthiest people. They're very, very stressed. They don't sleep at all. So these reference ranges are based upon this population. Okay. So B12, 200 to 1100. How did they come up with that number? Well, they take the average of, let's say, 1,000 people that have gone to the lab. So let's say the B12 level, the average level is around 400 or 500. They go 2 standard deviations to the right, 2 to the left. They make their nice bell-shaped curve, and they say, if you fall within this range, you're considered normal amongst other people. So the first problem with that is that those reference ranges are not based upon wellness ranges. They're based upon statistical ranges, 2 standard deviations, okay? And they're not based upon the research that's out there. What the biggest kicker is, and it makes me laugh every time I see this, I'll run a B12 level on someone. I run it on almost all of my patients. And there's always a disclaimer at the bottom underneath the reference range. It says, although the reference range for B12 is 200 to 1100, 10 to 15% of patients with levels below 400 may develop neuropsychiatric or hematological abnormalities. Okay. Why put the disclaimer? Why not change the reference ranges to reflect that? Well, because it's not their standard. It's not how they do it. So if the reference range is 200 to 1100 and you're at 250 and the doctor runs it, they'll say you're perfectly normal. Yet the disclaimer says anything below 400, you can develop neuropsychiatric issues. What are neuropsychiatric issues? Anxiety, depression, fatigue, memory loss, numbness, tingling, hands and feet, hematological abnormalities, changes in the size and shape of your red blood cells. So I always say to my patients, they're like, they'll say, well, why are you changing the reference range? I said, do you want me to compare you to a population of sick people? Because basically that's what they're doing. So how do I come up with my reference ranges? Well, it's based upon research. And it's based upon, what the clinical studies that have been out there. And it's also based upon my clinical observations. I know that when patients' levels of X, Y, and Z is let me see here. I think I'm running out of battery in my headphones here. Hang tight. Yeah, hang tight. So when I run these reference ranges, I will adjust them accordingly and use the ones that I feel are the most appropriate. And so once we do that, then I start getting people better. So I start treating people's B12 levels way above and beyond where another doctor would. They're waiting forever to, till the person's developing all these clinical signs and symptoms, and then they don't even treat it with B12. So let's say the person develops neuropathy due to B12 deficiency. They may put them on a drug to treat the neuropathy. And so you can see how the snowball effect goes. So, Rich, you want to hop on for a sec?
Yeah, I can. Let me shut the office door here.
Okay. I want to see if anyone has any questions at this point, because I know I'm throwing a lot of heavy information here, and I want to make sure that my my headphones here are not going to poop out on me.
Yeah, so Lisa's, I got an echoing phone in here, this room. Hold on.
Yep, no problem.
We need this out of here, Lisa.
Okay. Just or your phone.
All right, so we've tamed that. Did you tame your headphones? They're going to go dead soon?
I don't know if they're going to go dead or not. They shouldn't. I mean, we've only been talking for about an hour and a half here, so, or maybe a little less. I heard like a bloop, like the sound like the battery was going dead, but it may have been someone else's phone or someone's phone that kind of came through. So maybe it's not mine. But I wanted to kind of take a little break for a second and see if anyone has any questions regarding anything that we've kind of discussed. Throwing a lot of different information out at people, and so. But I hope everyone's kind of getting the gist of where I'm coming from with my whole talk here. This is something I have to. This is a talk that I have with almost all of my patients on a daily basis. Is just trying to educate them. I mean, that's really the role of a physician, is to educate. But how many doctors are really educating their patients? Not many, in my opinion.
If anyone has questions, go ahead and raise your hand. Oh, I see there's one. Let's see. Unmute. Go ahead, Jen.
Hello?
Yes.
Go ahead, I can hear you.
Oh, sorry. Yeah, how you doing? Thank you for the introduction. What about multivitamins and I know we touched on food sensitivities and different levels, but in general, hey, take a multivitamin, take a daily multivitamin. Do you recommend any of those, or should you just?
Yeah, I mean, a multivitamin is perfectly fine for most people, but a lot of times if someone has an overt deficiency, an extreme deficiency, like we talked about the vitamin A, thing. If someone has no gallbladder and you're just giving them a general multivitamin, it may not be enough. And we don't know if they're absorbing it properly. So yes, a multivitamin is a good foundation for anyone. But in my opinion, I always like to, because I get patients all the time that are taking multivitamins, yet they still have a slew of nutrient deficiencies. Maybe the multivitamins of poor quality. Maybe they have gut issues where they're not absorbing their nutrients. Maybe they don't have a gallbladder. Maybe they have kind of a leaky gut. Maybe they're taking an antacid, or maybe they're taking a drug that's depleting them of these specific nutrients. So I always look a little bit further. I always run blood work. I identify if there are nutrient deficiencies going on with patients. And a lot of times I save a multivitamin for down the road. That's kind of maintenance, I find, for me. But in general, it's not going to hurt you taking a good quality multivitamin. I have four vitamins that I recommend to almost everyone. Kind of a general multi, some fish oil, like omega-3s, because most people don't get enough in their diet. And if they do eat fish, most of the fish is farm raised that they're eating, and it's kind of like blind and diabetic fish that doesn't really have any nutrient value. And then I always recommend a probiotic, which is good bacteria for your gut. and vitamin D, because most of us, unless we're living in the tropics, we don't get enough vitamin D. And one more, sometimes I'll throw in some magnesium. I find that magnesium is probably the most deficient nutrient that I come across in the diet. One of the reasons why is because every time you take in a molecule of sugar or carbohydrates, you lose 23 to 24 molecules of magnesium. So most people are walking around really magnesium deficient. And what type of deficiency, what type of symptoms will present with a magnesium deficiency? Muscle spasms, cramps, sleeplessness, heart palpitations. There's all different type, any type of area of the body, any tissue that requires magnesium, if it doesn't get it, can go into spasm. And that means your nervous system. So people that have anxiety, magnesium can be a really, really good treatment for that. People that get Charlie horses in the middle of the night and cramps and stuff, magnesium deficiency. Someone with a heart palpitation, irregular heartbeat, magnesium deficiency. So those are my big ones that I typically recommend to my patients if they have nothing else going on. Like if I'm, okay, what should I take on a daily basis, doc? Okay, these are the ones that I think everyone should take irregardless of what their diet's like. But obviously we look a little bit further. We're doing the analysis. We're looking at the blood. We're doing some of these more advanced testing to identify the deficiency and correlate that deficiency with the person's clinical signs and symptoms, which most doctors are not doing. They're just failing to do that.
Okay. All right. Thank you.
Yeah.
I have a question.
Oh, go ahead.
I'm just curious. Thank you very much, Dr. Aieta, for coming on and talking about this stuff, because a lot of people, really aren't into that, or they don't know what to do because they do go to their regular doctors.
Yeah.
You're being up in Connecticut. I'm down here in Las Vegas. I'm not sure if you're able to do anything, across state lines or not. But I kind of have a couple questions. First off, what actual blood tests do you specifically request or do to get your findings to start your evaluation?
Most of the time, with every patient that I see, I use conventional labs to run the blood work through Quest or LabCorp or even a hospital lab. So I have a panel that I will run, and it's all, a lot of times it's individualized. So if I'm dealing with someone that is, depending upon what their symptomatology is, I will customize the blood work according to what's maybe going on with them. So there's certain tests that I will test on everyone. So for example, I check vitamin D levels on everyone. I check B12 levels on everyone. I check the storage form of iron on everyone called ferritin. I run a metabolic panel, which looks at liver function, kidney function. I do white blood cells, red blood cells. I'll do a lipid panel looking at their cholesterol, their triglyceride levels, okay, to see if they're overdoing their carbohydrates. If it's a woman, maybe we'll check their hormones if they have hormonal imbalances. We check the thyroid. So that case that I was talking about with the woman that was all the dry skin and the hair falling out, she had a thyroid condition. And no doctors identified it because the reference range was so broad. So the reference range for thyroid, now there's 5 tests that I run for thyroid. Most doctors run one, okay? They run a test called the TSH test. And that TSH test, the reference range goes from 0.27 to 4.5, pretty broad reference range. And that reference range, once again, is based upon statistical ranges, not wellness ranges. It's crazy because even the College of Endocrinology recommends a tighter range, yet they don't present that in the blood results. So I always check thyroid levels, and I run the individual thyroid hormones. Just checking something called TSH actually just looks at the signal from your pituitary gland down to the thyroid. It's not measuring what's coming out of the thyroid. So the thyroid's like our body's gas pedal. It tells our cells how quickly to burn up calories that we take in from our diet. It also regulates our body temperature. It regulates all these physiological processes. So thyroid's super, super important. I could do a whole talk, an hour-long talk just on thyroid and the symptoms and how to treat it and how to identify it. But so in that case, this woman was walking around completely hypothyroid, but because her doctor found that the one test that he ran, it was in the reference range. It may have been, just on the cusp, but he didn't want to treat it. And he didn't recognize that the symptoms she was presenting with were all low thyroid symptoms. He just looked at them as individuals instead of putting them all together. And he treated them accordingly. He treated each one of the symptoms with an individual palliative acute treatment. So when you look at blood work, there's a lot that we can look at. So when I look more at specialty tests, like we talked about the food sensitivity tests there, that's a little different. That's that's kind of like an outside lab, a specialty lab. I'll do stool analysis testing, which will kind of tell me what's going on inside the digestive tract just by kind of looking at poop. We send it in the lab. They identify the bacterial strains, how well things are being absorbed. There's a lot of different tests out there, but mainstream are not really using it, you know, and they're slowly adding certain tests. Like we talked about vitamin D, you know, 20 years ago, you'd have to look high and low to find a doctor that was running vitamin D levels. Now they're starting to run it a little bit more, but yet they're still looking at the reference ranges that the lab gives. So the reference range that the lab gives goes from 30 to 100. Okay. So if someone comes at 31, they're good? I don't think so. My reference range is based upon on the research out there. I go from 50 to 75. And that's what I think is the optimal range for vitamin D. So when I kind of went around your question a little bit, but there's a lot that, I mean, I can't pinpoint everyone's an individual. So I will fine tune their blood work profile to what's going on with them. I mean, I can run 1,000 tests. I'm not going to do that. But I will run specific blood work, and it's all, majority of that blood work is covered by conventional insurance. You know, they go to just a conventional lab. I get the blood work back, stuff that their conventional doctor would run. But yet when I get blood work from doctors, they run like 2 or 3 things and they say, oh, you're good to go. Like they'll run a white, you know, the red blood cells, white blood cells, they'll run the liver function, kidney function, blood sugar, and they'll run cholesterol. And if you're lucky, they may run a vitamin D. And if you're lucky, they may run a thyroid test. And then that's it. I probably run 3 times the amount of stuff that they'll run because I'm looking for the root cause. And I've asked doctors this. I have friends that are conventional doctors. I said, you know, why don't you go looking a little bit further? Why? They say, why should we do that? Why should we look further? We're still going to apply the same treatment irregardless. We're just going to treat the symptom. So, I mean, that's kind of what we're up against is, you know, doctors just trying to treat symptoms and not having the time. And I'm not going to, I'm picking on conventional MDs a little bit, and it's not their fault. That's how they were trained. A lot of the education comes from the drug companies. The drug companies kind of fund the hospitals. These drug reps are coming in educating doctors, you know, about different drugs. Are getting a lot of their continuing ed from a drug rep.
If the money is the incentive, then that's all they're going to go for, I think.
Yep, absolutely. Absolutely.
Well, if you're doing this, are you allowed to, I don't know if the word practice is correct, to go from Connecticut? Can you cross state lines? Since you're putting this information out, can you cross state lines and
I can
audio and okay.
Yeah, I can. I'm a licensed physician, and so I can put information out as much as I want. You know.
No. If somebody contacts you directly, can you? If I were to contact you, would you be able to work with me?
Yes.
Okay.
Yes.
Well, I didn't know if there was limitations due to some sort of laws that you couldn't go
Ideally, I like to see a new patient. I like to see him in my office so I can, for at least the initial visit. And that's kind of my rule of thumb. I like to be able to examine the person and kind of look for, be able to see them. And because a lot of what I do to uncover what's wrong with someone is to, have them in front of me, talk to them, have a dialogue, and be able to examine them, run the blood work. I do see patients, I'll do Skype consults, FaceTime consults, and so forth. But a lot of times I like to at least be able to see them at least once. but I do make exceptions for certain, certain cases and things like that and whatnot. So I see patients from, I have patients from all over the country that I will talk to on the phone, but a lot of them were existing patients. Maybe they moved away or, but we can talk about it. Definitely.
So if I ask for blood work, you could do blood work then?
Absolutely. I would email you a blood work form. You'd go to your local laboratory and, as long as the lab is within your insurance company's network, you'd go ahead and run the blood work. And I would receive the blood work, and then we would go over the results, and then we'd put a treatment plan together based upon the lab work and your clinical signs and symptoms. We put them all together. When patients come in to see me, I always tell them, I go, listen, you're going to tell me your story. I'm going to ask you a bunch of questions. I'm going to examine you. We're going to do the whole thing. I got half your story. The other half of the story comes once we do all the lab work. Now, then I have a full big picture of what's going on, and then I can address everything, And so is there things that are outside of what I do? Yeah, absolutely. If people aren't going to come see me if they're, I think my ear, you guys can still hear me, right?
Yes.
Let me know when you stop hearing me, because that means my earbuds are dead. So yeah, I tell patients, listen, I got half your story. The other half comes once we get all the lab work back, and then we apply a treatment plan. But there's cases where, like, if someone needs a colonoscopy, they're not going to come see me. If someone's having a heart attack, they're not going to come see me. Come see me afterwards. So there's limitations in what I do. But I'm a licensed physician, so I can make a diagnosis. I can run lab work. I can run, imaging. I can do whatever I need to do. Yeah, to uncover that. Who's next?
Thank you.
You're welcome.
Patrick has had his hand up. Patrick, do you want to unmute?
Yeah, I had a question. I had used tryptophan for a little while ago, trying to help with regulating some sleep issues, and can't remember where, but I read something about mixing it with collagen dissolved aids absorption. I never really could figure out from just kind of trying it whether that was true. I was curious if you've ever heard of that and what your thoughts are on that.
I wouldn't take it with collagen, because you kind of want to take it more on an empty stomach, because you want to take it away from other amino acids, because it will compete for absorption. Did you get that?
Oh, okay. Thank you.
Yeah. So, and you also want to take tryptophan along with B6, because B6 is necessary for your body to convert tryptophan over to serotonin. And the best form of tryptophan is one called 5-HTP, 5-hydroxytryptophan, opposed to just regular tryptophan. Tryptophan converts to 5-HTP, which converts to serotonin. In the presence of darkness, serotonin converts to melatonin. So if you take your 5-HTP or your tryptophan before bed, make sure that the room is very, very dark. And it's not, you don't got the TV going and everything else. Otherwise, you're not going to get proper conversion of serotonin to melatonin. And you do it on an empty stomach. Do it away from other proteins, because, like I said, when you do eat it with other proteins, there's a competition of amino acids. You want to target it. You want to get that amino acid into the brain so it can start working right away.
So is there some sort of, I guess, maybe delay in the processing, or is taking it at bedtime, the absorption, and then, transforming into serotonin and then melatonin, does that happen relatively quickly?
It happens relatively quickly. I would do it maybe a half hour before bed, empty stomach typically. But you got to figure out what dosage works the best for you. Okay, so one size does not fit all. One person may sleep like a baby at 50 milligrams. The other person may need 200, 300 milligrams to fall asleep. So you want to play around with it, so find your dose.
Definitely. Last question. You were saying taking it with B6 vitamins. I typically take a multi-B in the morning. Is there anything wrong with taking B vitamins at night, or does that affect sleep?
Yeah, I probably wouldn't take a full B complex at night. A lot of times you can find tryptophan that does contain B6. In fact, I mean, if you want to go on my website, draieta.com, I have a 5-HTP with B6. It's a sublingual. You just put it underneath your tongue and it dissolves. So you guys can check out my site. There's a bunch of different supplements and things like that on there. Those are all the ones I manufacture. All of them. I do them all myself. I source the raw material, make sure it's all quality, and I put the right combinations of everything together. So yeah, you can typically find one that has 5-HTP plus B6. And the form of B6 is very, very important too. It has to be an activated form called P5P. So it's already broken down. It's already activated. So that works the best.
Cool. Yeah. Well, thank you very much. And thank you for sharing all this knowledge so far.
Absolutely.
My favorite new thing that I've learned is it's something that I kind of knew intuitively, but had never been explained, about how fat and proteins, their first job is to be building blocks and then fuel secondary, whereas there really is no other job for glucose and carbohydrates. So thank you very much.
So yeah, the only real structure that carbohydrates, starches, and sugar can produce is body fat. And I mean, you can make, there's maybe 2% make a little connective tissue with some carbohydrates that you need, but the rest it's all fuel. It's like rocket fuel, you know. That's what your body, you know, it's like you're overfilling your gas tank. You don't need all that fuel. And honestly, our bodies, carbohydrates are not an essential nutrient in our body. Fat is. There's essential fatty acids and there's essential amino acids. There's no such thing as an essential carbohydrate. Why? Because our bodies can manufacture carbohydrates from other things. So this whole concept, these people saying that you need carbohydrates in your diet to be healthy, is completely false. I mean, you can live very, very healthy. It'd be the most boring diet in the world if you ate 0 carbohydrates. But you could do it, you know. Who's next?
Do you like CBD oil for treatments of any kind?
Love it.
Do you? Okay, it seems to be the craze these days.
I've been using, you know, CBD's been out for a while, and the thing is, you know, it's considered completely legal, 50 state legal and everything. I've been researching it for a number of years. I've been researching cannabis for a number of years. And CBD is probably one of the most important, you know, discoveries, you know, even though it's been around for ages. But I use it for all types of conditions, everything from A to Z, from inflammatory conditions to autoimmune diseases to sleep issues to anxiety, from depression. But the key thing with CBD, just like any type of supplement, you have to find your dose. You have to find out what works the best for you. You may try some CBD oil and say, this stuff doesn't work at all. Well, you haven't found your right dosage. Or maybe it's, you know, maybe you're that 10%, 5% that just doesn't respond to it. Or maybe it's the quality of it, or maybe you need a different strain of it. So I love it. I use it quite often in my practice. I think that everyone can pretty much benefit from it. The way that it works essentially is that we have this endocannabinoid system in our body that regulates all these physiological properties, and this endocannabinoid system can become dysfunctional. Did you lose me?
We can hear you, Frank. We can hear you.
Okay, you can. Okay, great. So yeah, I think it's an awesome thing. So really, really good. Anyone else? Yeah.
The next hand up was Genji.
Yep.
Yes, I'm back. Can you hear me? Sorry, I didn't know if
I hear you.
Okay. I know now. I've been seeing a trend in intermittent fasting.
Yes.
Is that something you also recommend?
Okay, so that's a great question. Great question. Yeah. What was the second part of your question? Go ahead.
Some of your patients, or in general? I was just saying, like, is it something you do with your patient, or is it something you also recommend in general, like, you know, general practice for?
Okay, so let's talk about intermittent. We'll talk about intermittent fasting. It is something I recommend, but only to select patients. I will only recommend intermittent fasting to a patient. Hello? Can you hear me? You guys can still hear me, right?
Yeah, we can hear you, Frank. He was muted.
Oh.
There was just like a residual signal that came through after muting.
Okay, no problem. So intermittent fasting. So with intermittent fasting, I love it. I use it with a lot of patients, but your body has to be in the right state to implement intermittent fasting. So if someone is a carb-based metabolism, if their body's relying on carbs, if they're burning sticks, twigs, and paper, does it make sense to intermittent fast? No, it does not. That person's going to be miserable. They need fuel. If their body's running on that, and you're skipping meals, you're going long times without eating, you're going to go into an adrenaline state. Your body's going to be running on straight adrenaline all the time because you need to control your blood sugar. So the best way to do an intermittent fast is to get your body to be a fat burner, to move into a more of a ketogenic state where your body's burning free fatty acids and ketone bodies as your primary fuel. You're throwing a big log on the fire. So yes, you can intermittent fast. You can go many, many hours without having to eat because your body is burning stored body fat. But if your body doesn't know how to access stored body fat, it makes no sense to intermittent fast. That's called starvation. So when you're intermittent fasting, you should be in more of a ketogenic state to get all the benefits of intermittent fasting. So I intermittent fast every single day. I start my first meal at 11:30. I finish my last meal by 6:30. I don't eat between 6:30, 7 o'clock until 11:30 the next day. And I feel perfectly fine. But if I adjusted my diet and was eating carbs all day long, I would never, ever in a million years be able to do that. I'd wake up feeling ravenous. I'd be passing out mid-morning. I'd feel horrible. So yes, intermittent fasting is fantastic, but pick and choose. You know, you gotta. It has to be for the right person.
Okay, thank you.
Yeah, you got it. Okay, so those are not working anymore. So I'm just going through my screen, so it's all good.
Okay, so your voice still sounds the same, and as long as you can hear us, we're all good.
Perfect. Yeah. So I was just I can hear you guys and you can hear me, so that's perfect.
Who has another question? Let me see if anyone raised hands. Oh, I think I'd already lowered hands. All right, so all the hands are lowered. You guys are free to speak openly when there is silence in between questions. Who has a question? Who has a question, doctor?
Well, I had another question since nobody else raised their hands. Is there? This is gonna be like a completely different from what you've been talking about. But I was looking into the vaccination issue that I think is going on, where we're unsure what they're putting in your body, where nothing's evident, and so on and so forth. When it comes to, I mean, we're all full adults, most of us, I think, in this room. But when it comes to infants and kids, I don't know if you dive into pediatric stuff, but is that something you recommend or
so you're asking what my thoughts are on vaccinations?
Individual.
Is that what you're asking? What my thoughts are on vaccinations?
Yeah.
Okay. So I'm not a huge advocate of vaccines. I have 2 children. Neither of them have ever been vaccinated. The reason why, I'm not opposed to the concept, of introducing an antigen, your body, your immune system is, producing antibodies and so forth. That's not the problem, okay? The big problem is all the crap that they put into the vaccines to elicit an immune response so that your body will start producing antibodies to that antigen. In those, they're called adjuvants. And there's all these chemicals and preservatives and everything else that they put into the vaccine, and they're there for a reason. They put detergents, they put, propylene glycol, which is antifreeze, in there. They put antibiotics in there, and they put aluminum. And aluminum has been linked to Alzheimer's disease, behavior disorders, a number of problems. They also still use thimerosal, which is mercury in certain vaccines. The flu vaccine still contains thimerosal. So and the problem is the safety studies. They really haven't tested these drugs appropriately. The biggest problem is that they've done no placebo-controlled studies on them. That's the biggest problem. And if you're vaccine injured, you have no recourse. That's the other problem. So knowing everything that I know and seeing the patients that I've seen over the years. So for example, just within the past couple years, I've seen probably a dozen patients, children, that have had vaccine injuries. Some minor and some where they are nonverbal after getting a vaccine. And so the whole process is everyone that gets a vaccine going to develop autism or some other neurological? No. But if you're genetically susceptible, and we talked about genetics, if you genetically cannot metabolize or break down all this crap that's getting pumped into the body, that can change, that can turn that switch on, that genetic switch, and develop some type of chronic illness. And they've never done these studies. They've never done the safety studies long enough. What they'll do is they'll take a vaccine and they don't do a placebo-controlled study. They'll take like some old vaccine and they'll compare it with that. And that's not the way that things should be done. I mean, they fast track all these vaccines, and they do this, because there's no recourse if there's any injury to it. You go to a vaccine court, there's money in this vaccine court, but you can't sue the drug companies for a vaccine injury. So with vaccines, I'm very, very cautious. Okay. And to each his own. I educate patients. I don't say you should never listen. If that's what you want to do, okay, but I'm going to educate you. I'm going to provide you with videos and research and things to read, and then make an educated decision. If you think after you read all that stuff, you still want to vaccinate, God bless you. Okay. So, but for me and my family, and if someone asks me, I will tell them what I think. It's not what they need to think, but I tell them what my thoughts are on it, and then they can do whatever they want with that information. So, not a big fan of vaccine, the whole concept, and the whole forced vaccine thing is really scary in my opinion. There's no informed consent. They're not telling you the issues that can occur. They test these drugs, these vaccines for like 4 or 5 days, and then that's it. Nothing happened within those 4 or 5 days. There's nothing wrong with the vaccine. Well, what about 2 weeks later and the kid, can't talk or something? They're not making eye contact. Well, it's not related to the vaccine because it's 2 weeks later. Well, maybe it took that length of time to manifest the problem. So that's my whole issue with the whole vaccine thing. I'm very cautious of anything that the big drug companies and they try and make money off of and stuff. It's just, they have all this vested interest. So, am I an anti-vaxxer? Yeah, probably.
Hey, Doc, can you hear me?
Yes.
That's a good one.
Thanks for sharing that. Are there steps that you take to protect your non-vaccinated kids because of your decision?
Yeah, I make sure that they eat well, take their vitamins, make sure their gut is in good shape, make sure they're not eating, processed and garbage food. Listen, if my kid got the measles, okay, probably all of our grandparents and parents and stuff that had the measles, if my kids get the measles or one of these other childhood xanthans, they're going to have immunity for the rest of their life. They'll never have to get a vaccine because, vaccines only last 4 to 5 years. And then you have to get a booster. If a kid gets the chicken pox, if a kid gets the measles, they're immune. They're immune forever. So,
do you have concern for like travel, out of country travel, or steps you would take for that?
Probably wouldn't travel out of country to a place where they can, them or myself would pick up some type of weird disease. I probably wouldn't just wouldn't do it. I understand the whole thing. Like, okay, if you're going to go to Africa, you need this type of all these shots and vaccines. probably not on my travel list, and probably not on my kids' travel list either. So that's how I would get around it. So
Cool.
I don't even know what the efficacy is of those vaccines when you do travel out of country, you know? So are they really truly protecting you? I don't know. And if I have confidence in the way that I practice medicine with myself and with my family, that if I did have to go out of country, I probably wouldn't do the vaccines. I definitely wouldn't do them. And I would just rely on the fact that I think I'm a healthy person and my kids are healthy. So that's just how I would approach it.
Awesome. Thanks for sharing that. I feel the same. I have a 16-month-old who loves sauerkraut. I can't believe it.
Awesome, man. Build that gut flora.
Yeah.
Absolutely. Build the gut flora. That's the best thing that you can do for them, is to have them eat lots of fermented foods, take probiotics. There's their immune system right there. Remember what I said earlier in our talk. 80% of your immune system resides in your gut. So you got to keep that gut healthy. And one of the best ways to keep your gut healthy is by eating fermented foods and getting plenty of probiotics, and not eating all the garbage, and doing things to heal the gut, eliminating food sensitivities. So there's a lot to it, but it's definitely
and avoiding the antibiotics, right? Because that shit just wipes it out.
Absolutely. You're right on the money. Yeah. When you take if you did every round of antibiotics, it wipes out your normal flora for up to 18 months unless you do something to replenish it. And when you wipe out that good flora with the antibiotic, you have a greater susceptibility for pathogenic bacteria to grow, and also pathogenic yeast. Because when you take an antibiotic, it does not kill yeast. And so the yeast will just grow in the place of it's called candida, will grow in the place of the good bacteria. So yeah, antibiotics are, listen, antibiotics save lives. I'm not going to dismiss that. I think out of the drugs that are out there, antibiotics are pretty freaking important.
They just have a cost, right? They just have a cost to use them.
Yeah, and you have to use them appropriately. I find that in my arsenal of treatments, I can use herbs that work 10 times better in certain situations than antibiotics. I treat Lyme disease without antibiotics, and I cure Lyme disease without antibiotics. So I use botanical medicine. So a lot of the when you think about antibiotics are pretty natural when you think about them. I mean, they're derived from, mold, basically, so penicillin, so, they're lifesavers, but you have to use them appropriately and sparingly. And you can use something in lieu of those antibiotics. I mean, I get patients all the time that come to see me that, like, okay, so let's say a woman gets chronic urinary tract infections and she's constantly on antibiotics, and it's just a vicious cycle. I typically will break that cycle by using natural agents in lieu of the antibiotics, getting the probiotics back into place, and changing their diet and doing all these things. They stop having these urinary tract issues, chronic. So yeah.
Well, thank you so much for sharing your wisdom with us.
My pleasure. My pleasure.
There was actually a question that I saw earlier today that Joshua, who just asked a question, had written up for Dell Bigtree, but I don't think we got to ask it in either of the interviews. So the going from memory, Joshua had written, what can parents do to effectively kind of protect themselves from this onslaught of mandatory vaccinations that seem to be going state to state now?
That's a tough one. It's a tough one. I mean, move out of state. I mean, it's hard. I mean, I'm afraid for my state. We have a pretty liberal state, and they call it progressive, and they're trying to change a lot of laws and big government control. And so if they force vaccines on us, I mean, there's no way I'm gonna comply. And I guess I'd have to homeschool my kids or move out of state, move to a state that respects our liberties, and that's all I can say. I don't know what else we would do, It's a tough situation, because I'm dealing with patients that live in New York State. And, they're getting, having the force vaccines on their kids. And, I have kids that have health issues that should not be getting vaccinated because, they already have autoimmune issues or asthma, allergies, and things like that. And now you're going to drop an insult like, 60 different vaccines on them all at once, and so, I mean, their systems can't handle it. My body, I don't think, could handle all those vaccines at this point. I mean, when I was young, yes, I was vaccinated as a child, probably a fraction of the vaccines that they're giving kids today. I probably had like 10 vaccines. Now they're giving like 60 vaccines. So it's just way overkill. And I think that it's going to just skyrocket from there. All these new drugs that are in the pipeline, vaccine for everything. And so that's their idea of preventative medicine, is to vaccinate. Not my idea of preventative medicine. I told you guys my idea of preventative medicine and what to do and what not to do. And vaccines aren't a part of it. I think that vaccines are more of a detriment to the human body than a benefit. That's for sure. Definitely.
Yeah. Are there any? Go ahead, Colin. This is that's Colin.
I've got a good strategy on the vaccine.
Go ahead, Colin.
Yeah, lie. Just tell the school that they've been vaccinated, and they may ask you for proof. Say, sure, I'll email it into you, and the chances of them following you up is about 1%. They just want to tick a box off. They don't really check those sorts of things. So you can just lie and just don't make a fuss about it. If you make a fuss about it that you're against it, they'll target you. But if you just fly under the radar, and I know a few people that just do that. They just fly under the radar. The kids haven't been vaccinated, but they don't tell anybody and nobody knows. And the school thinks they are. When the vaccines go through the schools, the kids are sick that day. And they say, I'll just go to the doctor and catch up on that one.
Pediatricians have to sign off on it. They have to, on the paperwork before kids can go into school, So that's one of the dilemmas here. Unless you're going to forge the paper that the pediatrician, has to sign off on, it's kind of a tough situation.
They forge. They've got little books and they forge. They do that.
Oh, they do.
I've never heard of anyone being caught.
Yeah.
Just while I'm there, I'm a physics major, university. When I was first at university, I earned money by tutoring med students. And the medical students had better marks than me, but in physics, they always just wanted to know how to think or what to think, never how to think. And I've had a lot of experience with working with IT, with doctors, and even recently with the Bachelors of Medicine. They're just a particular sort of person, the ones I've experienced, and they've got really good memories, very good at remembering and regurgitating, but give them a problem to solve and they're totally lost. Have a discussion with them about climate change.
Too mechanistic. Yeah, there's no looking outside the box. I understand where you're coming from 100%. Yeah. I don't fit into, that's why I chose this profession over conventional medicine, because this jived with me more since when I gave you that story from when I was younger. And, that's what led me on this path. And now that I see it more firsthand, seeing thousands and thousands of patients and, people that have given that, doctors gave up on them, they come see me and we do just basic rudimentary stuff. It's almost like a joke, like that they could get better just by doing X, Y, and Z. And it doesn't entail anything complicated, so I say that doctors always are trying to kill a fly with a sledgehammer. It's like, you don't need to, you can do it another way. You just have to think, you got to think outside the box and educate yourself, and don't just take what the drug companies are spewing at you as gospel, because it's not.
Yeah, myself, if I'm in a car crash and I'm smashed up, I certainly want the traditional doctor to stitch me back together and mend my bones.
Yeah. You get in an accident, don't come see me afterwards. We'll take care of you. But you go to the emergency room. That's where conventional medicine shines, is in the emergency room, honestly. And in these acute situations, they're the best around. But when it comes to treating functional problems that are basically related to dietary shortcomings, nutrient deficiencies, hormonal imbalances, underlying infections and whatnot, food sensitivities, they suck at it. But when it comes to chronic disease, they're even worse. So when that functional problem converts to a chronic illness, they're still trying to apply an acute treatment to a chronic disease, and it gets them nowhere. And it's just you're just patching someone up. Anytime you have to take a drug to achieve something, and you have to take that drug for the rest of your life, there's something wrong there. There's something, your body is trying to do something, but it can't, or it's doing something that it shouldn't be doing, and you're trying to stop it from doing that. So you need to figure out the root cause. Why is this person having all these symptoms? What are they doing there? What are they doing in their life, in their lifestyle, or their genetics or whatnot? So we get deep, much, much deeper than what the conventional doctors, I find, do, so. But, I refer patients to doctors, all the conventional doctors all the time, specialists, for diagnostic reasons. I'm not going to do a colonoscopy in my office. I need to know if someone has some major issue going on. I'm going to send them to a GI doctor, specialist. If someone's having chest pains, there's shortness of breath, I'm going to send them to a cardiologist to get a complete workup and then come back and see me. So I use conventional doctors, I use specialists to basically provide me with more information, with things I can't do in the office or just out there. It's outside of my scope of practice, and to get a second opinion. And that guides me towards what I need to do. And in some situations, I may exhaust everything that I can do. And you say, okay, well, we'll keep looking, but maybe you need to apply a drug treatment for a period of time until we can figure something else out. If someone comes in to see me and they're on high blood pressure medication, I'm not taking them off day one. I'm going to say, listen, let's change your diet. Let's get you on some supplements. Let's do all these things. And then we'll wean you off of it. And that's the goal, so time and place for everything, right?
Yep. One thing I'm a great believer in is deep tissue massage as well. That can do wonders for your health.
Oh, absolutely. Absolutely.
Yeah. Anyway, that was my bit anyway.
Great.
Good to meet you.
Thank you. You too. Great meeting you. Anyone else? Any other questions?
I missed the first hour, but did you cover anything about allergies?
Yeah, we did a whole talk about food allergies, food sensitivities, seasonal allergies, kind of along the same lines. It's just your body's overreaction to things in the environment. So I do a lot of things to desensitize people to seasonal allergies, environmental stuff, just balancing their immune system, strengthen the integrity of the mucous membranes. Remember, that's the entry point of where everything's getting in through the lungs, through the sinuses. If that barrier is not strong, and that comes down to your overall nutrition, things are going to get in there that aren't supposed to, and your immune system is going to overreact to those things. Same thing in the gut. I find that most people, if they have a lot of seasonal allergies, they also have a lot of underlying food sensitivities or food allergies that are compounding it. When someone comes in and says, I have year-round allergies, I'm always congested, I'm always clearing my throat, irregardless of what's going on outside or inside, they typically have food sensitivities, food allergies that need to be addressed. And then their symptoms, will go away. They'll have less of a hard time with those seasonal.
Thanks. My wife's going to tell me I told you so.
There you go.
I've been tested for it's not pollen or anything like dust mites reacted, but I'm pretty diligent about combating dust mites, and still it just happens once a week.
You got to look into
randomly
sensitivities to foods and things like that, because when you listen to the replay of what I talked about, I talk about how food sensitivities are delayed or cumulative. So you can do something once and have no reaction, but you do it 3-4 times in one day, eat that particular food, you're going to may potentially develop a reaction because of just the load, of that antigen in your blood getting in there from the digestive tract.
Thank you so much. I'll definitely watch the replay, and I won't have you repeat yourself.
Absolutely.
Thank you.
You're welcome.
Hey, so do you think antigens are essentially like a Band-Aid? I mean, do you use homeopathic treatments or antigens to treat? And maybe you covered this. I'm sorry. So if you've covered it, I apologize. But
no, I haven't. I haven't covered. But I will use homeopathic dilutions. Like I have a product that I will use. It's to treat seasonal allergies. It's called a Northeast. It's in my area of the country. It's called a Northeast Allersode, and basically it's homeopathic dilutions of all different types of pollen that's endemic to in this area. And we start off it's kind of like an immuno type of therapy. So you're giving informational dosages to the immune system. That's how homeopathy kind of works. And it just, you're balancing the system. So yeah, I will do that with patients, and it works really, really well. Every year I have patients, before allergy season, I give them this little bottle. And I say, start with 1 drop. The next day do 2 drops. So you're gradually introducing it, and allergy season comes and goes, and they have no problems typically. But we're also doing other things. We're addressing the immune system from a dietary perspective. We're getting them on the proper nutrients, making sure the gut integrity is all good. So there's a lot to it. It's multifactorial. I don't just use one therapy, because homeopathy in itself is a therapy. Acupuncture is a therapy. So I incorporate a lot of different types of therapies individualized towards the case. I have a patient come in and say, I have X, Y, and Z for symptoms. I want acupuncture. And I may say, I don't think acupuncture is the right modality for you. I think you need this and this and this. And so we go from there. So there's a lot of different therapies that we can implement. There's a lot of tools in my toolbox that I have at my disposal, whereas conventional medicine has a limited scope of tools in their toolbox, and not many of them address the root cause. I mentioned earlier that one of the drugs that does actually address the root cause are antibiotics, okay? But a lot of the other drugs out there don't address the root cause of what's going on with most people. Maybe an antiviral drug will address the root cause. So, but a lot of these other drugs that are used to poison this enzyme system, upregulate this, block this, do this, they're just working against your body's natural physiology to eliminate symptoms. That's all it's doing. It's not really addressing the underlying cause of why the fire alarm is going off. You're not putting out the fire, you're just smashing the fire alarm with the drugs. That's how I look at it.
Thanks a lot.
You're welcome.
That's a good metaphor. You're just smashing the fire alarm with the drugs.
Yeah, absolutely.
Any other questions for the resident doctor?
And we could listen. If you're missing any, we could always do this again down the road. I'd love to be back and talk a little bit more. Today, I didn't really have anything structured planned, any specific topics. But if you gave me a specific topic, I wanted to kind of hit everything tonight. I wanted to give you a little taste of everything that I kind of deal with. I mean, is there more? There's a hell of a lot more. But if there's a specific topic, or I can talk on just that and for a period of time. So we can always do this again. Absolutely. I'm more than happy to. I'm more than happy to share the knowledge. I mean, it's taken me 18 years to acquire it, and that's my pleasure is to share it and get people on board with what we're doing here, So it's knowledge is power, as all of you guys know that. And if you're going to rely on your conventional doctor, mainstream media, all that stuff to acquire that information, you're not going to get it. You're not going to get it. It's like if you want to hear half the story or a spin on it, yeah, that's where you're going to get it from. So it's hard. I mean, in this day of information, it's a hell of a lot easier to acquire this information. I mean, I remember when I first started, I mean, it was like information is booming now. So I have patients that come in to see me. Honestly, I think they know as much as me, some of them. I mean, they study and they know so much about their, online. They go here and they go there. And some of the stuff is, my job is to filter through all of that for them and say, okay, yes, that's right, but that's not right, and this is right. So yeah, so in this day and age, definitely knowledge is definitely power. And if you have that knowledge, and that's one of the best things about what I did by going to medical school, is that I can treat myself appropriately and my family, which mean the most to me, you know? So if I can keep myself healthy and I can keep my family healthy, everything I did, all the schooling and everything that I've learned over the years was 100% worth it. And then if I can help people on top of it, it's even better, you know? And so it's funny because I say, you know, patients will ask me like, you know, don't you get so pissed off about these conventional doctors and how they're just not learning things? I said, it is what it is, you know, and I hate to say this, but their incompetence keeps me in business. You know, it's like what their lack of knowledge gets people to come see me, you know, so, and we give them the information that they need. So.
Well, I think it was very well presented, and for not having anything structured and just doing that off the top of your head,
I like to go off the cuff, and then, but you know, if you gave me a topic, I'd have it a little bit more organized. But I like to go through and just, you know, have people pick my brain too. The Q&A part is the best, because then I can answer each individual question and target it that way. So, but love to come back and talk more.
Yeah, and one of the topics I'm sure is vaccinations, because there's a lot of parents that are in similar situations and, you know, want to learn more, and want to learn more importantly how to communicate with loved ones and friends in their life such that people understand it's like vaccinating and not vaccinating are both tactics of people who love their children.
Absolutely.
And if we could start there and like help people bridge the gap, that's always very useful. And the way that the gap is bridged is through facts wrapped in a narrative, usually.
Yeah, absolutely. I mean, I can go on and talk about you know, cases and so forth. And, you know, do I know all the statistics? I don't. You know, it's not my, you know, I can talk to someone and I can guide them in the right direction to read this and, you know, listen to this guy and listen to this, and you'll get a bigger picture. I can start the ball rolling and just, you know, spout out a little bit and kind of convince, you know, educate them. But I always recommend that people look a little bit further and don't just take your conventional doctor's word for it. You know, it was, you know, when we were having kids, you know, and it's my oldest is going to be 10. And at the time it was like, you know, it was a big thing. I had to educate my wife on all this, you know, and I knew, you know, it's, you know, I had the knowledge there, but still you second guess yourself and you think, but I just had to hold true to my philosophy and, you know, what I do. And that's kind of how I made my decision to not vaccinate my children. And to each his own. You know, it's everyone has a reason, and I'm not gonna come at you because you are vaccinated or you're not vaccinated. You know, it is what it is. You know, it's just people have to make that own decision about what they're comfortable with, and honestly pray for the best that nothing does happen when they get vaccinated. You know, so. I don't know. I forget what the statistic is of how many vaccine injuries there are per year, and how many, you know, injuries or even death occur. But it should be zero. Okay, I mean it shouldn't be. There shouldn't be any kids dying from a vaccine, a drug that was properly prescribed or whatnot. So, but there is, unfortunately, and so people need to know that, you know, and. The efficacy of the vaccines, that's another thing, is that how effective are they? You know, there's no real good research to show that, you know. I mean, you look at trends in diseases, and a lot of these diseases, you know, that they say were eradicated by vaccines, they were on the downswing anyway before the advent of those particular vaccines. So, you know, with improved sanitation and things like that, as we, you know, you got to look at the whole big picture. There's this graph that I have, and it shows like this downtrend, you know, even polio and so forth. And then it shows the advent of the vaccine, and it was just on that downhill trend anyway, you know. So how much did the vaccine contribute to the eradication of all these diseases, you know? So it's just, you know, I tell people just be educated, you know, look into it, and then make an informed decision.
Yeah, everyone always says, what about polio? I say, look at the graph.
Look at the graph. I mean, like I said, it was on a downhill trend as it was, you know, and then the advent of the vaccine, it was still going down, you know, so we don't even know what half the crap that they put into these vaccines. I mean, I don't even know how they get, well, I know how they get onto the market. They fast track them, and there's no safety studies. That's how they get them out there so quickly. You know, these certain drugs, they're in clinical trials for like years and years and years, 10 years before they come on the market. Within 5 days, they put a vaccine out. It's like, come on. I mean, it's like, what are the safety standards with that? It's just, it's crazy. I mean, it blows my mind. But
yeah, there's a vaccine that they're making parents get when they're going to visit children in the hospital, which is the whooping cough vaccine.
Yeah.
And the stuff I read on that was that the whooping cough vaccine just masks the symptom. It doesn't actually make it.
Yeah. It masks the symptoms so that they'll go to the hospital. They won't have the symptoms, but they could still be transmitting the infection. So yeah, very, very crazy stuff.
Yeah. Also in Australia, we're having a record flu season, which is not stopping. It's just going on and on and on. It seems that the people getting the flu, having the vaccine, are getting the flu just as much as the people that aren't.
In my practice, I see the people that I've seen clinically with the flu, you know, in the past, most of them have had the flu vaccine. I mean, so I don't know how much. I think in fact that flu vaccine with all those adjuvants actually weaken the immune system to make you more susceptible. The best treatment, I think, for preventing the flu is vitamin D. You know, vitamin D has been, and that's, you know, when you really look at it, why do people develop the flu more in the wintertime and less in the summertime? All these theories, you know, you're more in close contact and things like, no, it's because of the lack of sunlight in the wintertime and the lack of the low levels of vitamin D. What I'll do is at the first sign of a cold or flu with patients, have them for 3 days. I'll have them take massively high doses of vitamin D and vitamin A, and 9 times out of 10, they don't develop the flu. It knocks it out. So much better than a flu vaccine, much safer, and it works with your body. You know, I'll use 50,000 IUs of vitamin D for 3 days and 100,000 IUs of vitamin A for 3 days. And then 9 times out of 10, they don't have any reaction. They don't have any whatever was going on is gone. I have a homeopathic product that I use that works really, really well for flu prevention. So there's a lot that we can do. And as far as for flu treatment and stuff, I can, reduce the duration of the flu if you do get it by half. The drugs out there like the nasal, the Tamiflu and so forth reduces it by half a day. That's the research out there. So you're going to take a drug that potentially causes all of these side effects that's going to reduce the duration of your flu by half a day. I mean, so, okay. Is it statistically significant? Yeah, I guess a half a day, but, is it really worth it in the long run? So.
And when you guys are taking vitamin D, remember it's fat soluble. So.
Yeah, make sure you're taking it with some fat. Make sure you got a gallbladder.
I don't have a gallbladder, so I take the ox bile.
There you go. Take the ox bile, and that will work. One of the reasons why, the gallbladder is a very necessary organ. And one of the reasons why people develop gallstones or gall sludge is because a lot of times, that we were fed this whole low-fat paradigm. So if someone's eating a low-fat diet for a majority of their life, their gallbladder gets lazy. It just doesn't contract. It's not secreting bile. So sludge builds up and stones build up in there. So once again, a good high-fat, moderate protein, low-carb diet is the best. So that's what I promote. And, so yeah. Any other questions? Are we good?
All right, I think we're good. If you guys have questions, hold them for the next meeting.
Yeah, definitely. We'll do this again. If you guys liked what I had to say and you got stuff out of it, then yeah, I would more than happy to come back on. And if you have any, even before I come on, give me a whole list of questions and topics. I'll hit them all. I'll try my best to hit them all.
Anyone who has questions for Dr. Frank can send them to support@getautonomy.info, because right now there's no other email going to that account, so that's a good place to collect those. That goes for people watching the replay too. Even if you guys didn't make it live, you can send your question in. All right, Frank, what a stellar performance. Very impressive.
Thank you.
And Lisa's smiling. I don't know, she'll unmute, let's see.
Yes, it was excellent. Thank you so much.
You're welcome.
And that was me who unmuted in the middle. Lucas was playing and my phone was touched and unmuted.
Oh, not a problem. I was like, who is that?
Yeah, of course it was me.
All good.
Yeah, they were playing hide and seek. That's what happened in the middle.
And just my final thought on maybe having another guest lecturer who Frankie might even be interested in listening to. There's a vaccine attorney that I've been in touch with in the past, and his name is Alan Phillips. I think he's maybe Virginia or South Carolina. But I'm going to reach out to him again and see if I can get in touch with him, see if he'd be interested in doing a guest lecture and teaching us a little bit about the law regarding vaccines and what we can do to protect ourselves. Like, for instance, we're homeschooling, so it's not a thing, but it's a thing with our pediatrician, et cetera. And, you know, what can parents do to protect themselves against the state? So I'll keep you apprised of that.
Crazy times we're living in.
I know.
I know. They're trying to take more and more of our rights and our liberties away, and people are just going along with it. I mean, it's just they need to wake up and use their brain and be informed and educate yourself. Don't just take the mainstream media's word for it. I think that's one of the biggest problems. They're the biggest problem, is that it's just brainwashing people to think a certain way and to do things that they're this is the right thing to do. Okay. Well, show me the research on it. Show it to me, the real research. They can't, and they just brush it under the rug just like everything else. So, yeah, vaccine's a hot topic. It's a tough one. It's really individualized. People have to just make their own informed decision, but people need to get informed. That's the big thing.
Exactly.
Yeah.
Well, thank you so much.
All right. I'm looking forward to watching the replay myself. See
I'll get it to you.
Yeah, I know how that is. You're in the zone, so you want to see what you said now.
Yeah, see if I
sounded so good.
See if I sounded good or sounded like a fool. I don't know. So we'll find out.
It was excellent.
Thanks.
As the typical Italian at the end, Sam. But what do I know?
What do I know? All right. We'll see you guys later.
I'm going to conclude this meeting. Everyone else can meet over on in the clubhouse on Discord.
Thanks, Frankie. Have a great weekend.
All right, you too.
Have a great night.